Are we ready?
Yeah.
Really pretty. We are fortunate.
Good morning, ladies and gentlemen. Thank you for bearing with us on the time. Welcome to a special meeting of the Madera County Board of Supervisors. Today is Monday, December 2nd, 2019. Time is 8:39 a.m. I will call this meeting to order. We'll start. Rob, will you lead us in the invocation? And David, will you lead us in the Pledge of Allegiance?
Very good. Let us pray. Father, thankful for this beautiful day, this beautiful rain you've given us for this holiday of Thanksgiving, when we can recognize something we should do every day, but a special time of year for the many blessings that you provided to us. We just ask for guidance today, for wisdom, and that you would lead the discussion, and we ask these things in Christ's name. Amen.
Join me in saluting the flag of what is still the greatest nation in the earth. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right. Public comment.
Public comment. The first 15 minutes of each regular session are set aside for members of the public to address the board on any matter under the jurisdiction of the board but not appearing on the agenda. The board will not take action on any items presented under public comment. Speakers are limited to 3 minutes. Anyone addressing the board is asked to print their name clearly on the speaker sheet at the podium and state their name and county of residence for the record.
Any public comment? Seeing none, I'll call close to the public. Oh,
Rob's got one too.
After public comment.
yeah.
Oh, I just wanted to say that we had, in Awani, had 4.14 inches of rain with a little over 2 inches of snow. So we got the season started late, but we got a big jump on the amount. So that's it.
Well, we appreciate all the beautiful white cap mountains that you guys are providing for our view shed right now. And for you on the air board, thank you for allowing us to be able to see those as well. All right. With that, I'll close the public comment portion. And Supervisor Poitras.
Thank you, Mr. Chairman. I'd like to read a statement. Before the next item on the agenda, I would like to announce that I will recuse myself from discussing and voting on this next item due to my board member status with one of the bidders. I ask that the board's minutes reflect my decision not to participate. With that, I will excuse myself from the chambers for this item. Thank you.
See you, boss.
See ya.
Thanks for getting up and coming in early. Hope you didn't cut your Thanksgiving short just to be back here to read that.
Long drive. Yeah.
All right. Item 3A.
3A, County Administration Department, discussion and consideration of presentations from requests for proposal respondents and discussion and consideration to authorize the purchasing agent to issue a notice of intent to award a contract for RFP number 19-0365, provision of healthcare services at the adult and juvenile correctional facilities.
Good morning, Chairman and members of the board, Regina Garza, County Council. Because today's agenda item is not a common occurrence, I thought I'd take a few moments to provide a brief overview for you, and then also to allow you to ask any questions of myself or my colleague Dale Bacigalupi before we get started. So in accordance with the terms of a request for proposal, specifically number 190365, contractors who submitted proposals are being provided an opportunity this morning to present them to you. Under the terms of the RFP, the presentations are not intended to allow contractors to alter, amend, or supplement the proposals in any way. in terms of the scope of services or the prices that were offered. The risk here that's important to keep in mind is ensuring fairness in this procurement process. So the proposals that the contractors submitted are lengthy, extensive, and complex. They have been thus far withheld from the public disclosure until the board authorizes your purchasing agent to issue a notice of intent to award and to begin negotiating a contract. I have copies of the proposals here for you.
Oh, that's all? Gee whiz.
If you want them, I can give them to you. Staff has prepared and is ready to summarize these results. They've reviewed them very thoroughly. If you would like them, I can give them to you, but you should know that they would then have to be available to the public as well under the Brown Act principles, specifically Government Code Section 54957.5, subsection A. They will be distributed to you, the contractors, and any members of the public that are interested in them after today's agenda item, if you decide to begin negotiating a contract. But again, if you want them now or at any point, we have them for you. Finally, being mindful of the risk here and the county's ability to negotiate a fair and cost-effective contract, at the end of the presentation, staff will identify for your board if there was any new or fresh information that was provided during the presentations. And in closing, this consideration is your legislative process, and as such, you have to discuss it and deliberate it in open session. With any legislative act, members of the public will be provided an opportunity to comment on the item at the end of the item. And we ask that the contractors limit their comments to the time allotted for the presentation and the time reserved for questions from your board to them. And thank you. So unless there's any questions, your purchasing agent will begin the item.
Yeah, and I also just wanted to say when presenting that to all the presenters to focus on their own and not deviate into saying why they're better than another entity. So just focus if you're the best, then just talk about your own merits. So that's just something that I think
Can I
is
request to
important.
get my copies of it in case I want to see something while they're giving it?
Yeah.
Might be something I want to read when they're telling us about it.
I think we'll.
Max,
All right.
from yours?
Yeah. Yeah, I think we. All right, Darren?
Good morning, Mr. Chairman, members of the board. Darren McCandless, purchasing agent with the administrative office. With me this morning are the 4 members of the selection committee responsible for evaluation of the proposals throughout this RFP process and for making a recommendation to your board regarding the awarding of a contract pursuant to the RFP. They are Manuel Perez, Director, Department of Corrections, Chris Childers, Deputy Chief Probation Officer, Dennis Cook, Director of Behavioral Health, and Jessica Leone, Analyst from the County Administrative Office. Before we get started with the presentations, I wanted to take a few minutes to quickly review some of the objectives and scope of the RFP, as well as the process to date. You got it? On June 26th, with a 3-1 vote, your board rejected a proposed agreement, 3-year agreement with CFMG, now WellPath, the current healthcare provider at the Department of Corrections and Juvenile Hall. The board instead approved a 1-year extension with CFMG to June 30, 2019, and directed staff to conduct a request for proposal for these services. On April 16th, 2019, the RFP was issued by the Administrative Office with an original submittal date of May 16th, 2019. Turning to the RFP itself, the Madera County Department of Corrections has an average daily population of 468 inmates. The facility has a 5-bed infirmary, exam rooms in each of the inmate housing modules, a dental lab, 2 safety cells located in the intake area of the facility. The county juvenile correctional facility and correctional camp have a combined rated capacity of 70 juveniles. The juvenile correctional facility has an average daily population of 44. Facilities include a main medical office, nurse stations, exam rooms, 2 2-bed units for medical isolation, and 1 safety cell. The stated objectives, or some of the stated objectives of this RFP, which can be found in the RFP itself beginning on page 11, include but are not limited to delivery of healthcare services at the county facilities in a humane and cost-effective manner, provision of effective management of healthcare professionals engaged in the delivery of healthcare services in county facilities, provision of a program of continuing education and training of both county and contractor personnel involved in the care and maintenance of incarcerated adults and juveniles, and the expansion of healthcare services in-house, thereby reducing outpatient costs for healthcare services and transportation to the Department of Corrections and Probation Department. In terms of scope, the RFP included a broad range of medical, dental, mental health care, and administrative services, including but also not limited to daily triage, sick call, and infirmary care at the facilities, the development and implementation of a written detoxification policy, provision of on-site pharmacy, laboratory, radiological, and other ancillary services, provision of dental services to inmates at the facilities, management, distribution, storing, controlling, and administering of all pharmaceuticals, development and implementation of written policies and procedures which comply with all applicable laws and regulations, and mental health services, including assessment, psychiatric services, medication support, suicide prevention provided by licensed mental health personnel, along with documentation of all contacts with inmates for medical health services. The full scope of services are included in the RFP beginning on page 13. Procedurally, as I mentioned, this RFP was issued April 16th, 2019, with an original submittal date of May 16th, 2019. On 24th of April, a mandatory pre-proposal conference and walkthrough of the facilities was held. May 1st was the deadline for submittal of bidder questions. The submittal date was extended with addendum number 2 to June 14th, 2019. Addendum number 3 was issued on May 17th, which provided all answers to all of the bidder questions. The submittal date was again extended with addendum 4 to June 28th, 2019, and on that day, the administrative office received 3 proposals, one from WellPath, one from NAFCare, and one from Madera Community Hospital. On August 1st, 2019, the county selection committee received proposals or presentations from all 3 bidders. On October 25th, 2019, addendum number 5 was issued regarding contractor presentations to your board. As mentioned by County Council, today at the board's request, each of the proposers has been asked to make a brief presentation to the board to summarize their respective proposals. Each company has been instructed to limit their presentations in 2 ways to ensure that the process today is fair for all 3 proposers. First of all, presentations shall not exceed 30 minutes. Secondly, presentations must not add to or alter to the previously submitted proposals. Each presentation will be followed by up to 30 minutes time period for your board to ask questions of each company. And following the presentations, staff will summarize the committee's recommendations, at which time your board will be in a position to take action. Before we begin the presentations, are there any questions?
with all those services, I think I need to go there and stay a while. I mean, I got everything. I get mental health, dental, drugs. I mean, gee whiz, I better line up.
I'm sure the statute of limitation on some of the things you've done in the past will still allow
Oh,
you.
darn it.
All right.
No, if there's no questions, then we'll clear out and let Madera Community Hospital get situated to make their presentation.
So it looks like we are going to go in the order Madera Community Hospital, NAFCare, WellPath. Is that
That's
correct? Okay.
WellPath NAFCare, is that what you said?
Yeah, well past, yeah.
Oh, I had my list that went different.
It's Madera Community,
It's on here.
followed by WellPath,
Okay.
followed by NAFCare.
Okay, yeah. I had mine.
Page 8.
Now, will we have them at the table since it's going to be lengthy, so they're not standing?
Yeah, so if you sit at the table, we have a pointer that will allow you to move through the PowerPoint slide. So if you guys want to.
All right, so Madera Community Hospital, you're up first.
Right, but we can go through here, yeah.
I'm just gonna have here.
I'm just going to be presenting.
Oh, so you can stand there if you'd like, or you can sit.
I'm fine with standing here.
Okay.
Thank you. Hi.
I wanted to let you know, too, that our timer is set for 30 minutes, but it will only show the last 10 minutes on the screen.
Yeah, I do need them, but
Did you happen to hear what Rhonda just said?
I'm sorry, she was talking to
Yeah,
me.
Rhonda, say it again.
We have our timer set for 30 minutes. However, the only time that will show up on the screen is the last 10 minutes.
Okay, perfect, thank you.
There we go.
So good morning, thank you. My name is Karen Paulinelli, and I'm the Chief Executive Officer for Madera Community Hospital and our healthcare system. I do want to thank all of you for providing us time to explain our qualifications for serving your adult and juvenile healthcare services provider. I also want to introduce some people here with me today. Dr. Ali Rashidian, who's the Director of Inpatient Services for Madera Community Hospital. Dr. Rashidian is triple boarded, certified in internal medicine, pulmonary medicine, and critical care medicine. Dr. Rashidian is our proposed medical director for GEL Healthcare Services. In addition to Dr. Rashidian, I have here with me also is Dr. Terry McGovern. Dr. McGovern is board certified in emergency medicine and is the medical director of our emergency services department for Madera Community Hospital, and he will be essential in the coordination of healthcare services for the jail. I also have with us today some of our board members of Madera Community Hospital's Board of Trustees in support of our proposal as well. So they're here in our audience. Thank you for being here. I do know now today that you have received our proposal, and I know you probably haven't had time to review it because I just heard this morning that they have not been distributed to you. But what I want to say today is I didn't want to go through the proposal with you because it's very lengthy. Instead, I want to use this time for Madera Community Hospital this morning to demonstrate why Madera Community Hospital is your best choice for jail medical services. So Madera Community Hospital, and I know you understand this as well, as Board of Supervisors, you have a vested interest in the health and the safety of our county. And I want to give you a little history. Back in 1976, there was a landmark decision by the Supreme Court which mandated counties to be responsible for ensuring healthcare services for those in jail. Madera Community Hospital understands the county's obligations and the risk involved with providing health care in the jail. And we also understand that inmate health care is an important part of the county's overall public health program. Madera Community Hospital also understands the challenges and the risks of providing these services. And we want to discuss those challenges and those risks so you understand that we do understand them. We want to acknowledge that providing health care in a jail setting has challenges. We also know inmates are not in jail because they're sick. They're in jail because they broke the law. In spite of this, many inmates have complicated medical problems. Providing jail health care is not easy. Part of the reason it's not easy is that the inmates aren't there for very long, and they have unmitigated illnesses that complicate the treatment. And many of the inmates have untreated diabetes, hypertension. Many of the inmates are addicted to drugs or alcohol and may have not had access to health care for many years prior to being arrested. Often the health status of those that are booked is unknown, and many times no access to the inmates' medical history is available when they present to the jail. Many of these inmates have behavioral health issues, HIV, hepatitis C, AIDS, or suicidal tendencies. Individuals with these high risks make caring for inmates in the jail very challenging, and we want you to know that Madera Community Hospital understands that. Resources can be a challenge also for inmates in jail for long term. And we understand that the county holds the risk for these services provided, and we want you to know we understand that. If the county fails to provide adequate health care services, the county can be sued. We've all heard that. Lawsuits are very common in the jail. In fact, I wanted to do some research about lawsuits in the jail because this has been brought up numerous times. And according to a survey conducted in 2018 by the Pew Charitable Trust, 91% of large jails have been sued over medical care related issues. And for example, in my research, I found that Fresno County and Riverside County were both found to provide inadequate health care for jail medical services. And the Prison Law Office now has health care oversight of these institutions. So again, the oversight can be very costly to the hospital, to the county, and this is why choosing a health care provider for the jail and juvenile hall is so important. And we want you, the Board of Supervisors, to understand that we understand that. Madera Community Hospital understands these potential risks, and as a local healthcare provider are committed to providing better health care for our community, and we are committed to mitigating these risks and improving the outcomes of all inmates being cared for at the Madera County Jail. You, the Board of Supervisors, have many factors to consider when deciding how health care will be delivered in the jail and juvenile hall. And you can choose a for-profit national organization, or you could choose a local not-for-profit organization. When choosing to partner with Madera Community Hospital, you are choosing to partner with your local not-for-profit healthcare delivery system with local leadership and a board of directors who are very passionate about quality healthcare in our community. We have board-certified doctors and local leaders who would be available to the jail 24/7. Madera Community Hospital's priority to serve the healthcare needs of the county and has remained our priority for many years. Our hospital has 48 years of continuous accreditation. Madera Community Hospital adheres to the patient accreditation standards when we provide care, and no one has to convince us the value of accreditation. It is our standard, and we will bring that same standard to the jail if we provide services there. Madera Community Hospital is an independent acute care general hospital. We see everybody that comes through our door, and we have been in business, like I said, for 48 years. We have a local governing board, a local executive team, and we have more than 200 doctors on our medical staff. Madera Community Hospital is in a unique position to provide health care to the jail inmates based on our years of experience and our expanded medical services for both inpatient and outpatient services. We are the safety net for our community. Local law enforcement, for some of these examples, our local law enforcement brings homeless people to us who are intoxicated. The Department of Social Services brings to our ER adults in poor living conditions to our emergency room. And again, the jail sends those arrested to the hospital for screening prior to booking at times. Once inmates are released, they're often seen in our emergency department and in our clinics. Madeira Community Hospital can provide a higher level of healthcare services than any other vendor can provide in the county. Madeira Community Hospital is positioned to fully implement the jail's healthcare program designed to meet the needs of the county's incarcerated and ensure continuity of care once they are released out into the community. Madeira Community Hospital is committed to fulfilling the county's legal obligation to providing healthcare services with the highest quality and lowest risk. Our proposal is based on the National Commission on Correctional Healthcare Standards. Madeira Community Hospital wants to improve access to care. In our proposal, we would do assessments to the inmates within 2 days for adults and with 96 hours for juveniles. We would have 24/7 qualified healthcare coverage, and again, our physicians would be board certified. The county established a selection committee to review the healthcare proposal and recommended a vendor. In these next slides, I really want to address the proposal scoring matrix and how Madeira Community Hospital meets or exceeds these standards for providing healthcare services to jail patients. If you look at the screen on the right is the scoring matrix between the three vendors that submitted their proposal. This was brought to you at the last meeting here. And Madeira Community Hospital ended up with, I think it's 17.1 points, and we came in last on the scoring matrix. And if you look to the left is a criteria on what they scored all of the different vendors on. And so I do want to spend a little time talking about these 5 categories for the jail medical services. The next slides that we have will demonstrate how and why Madeira Community Hospital meets or exceeds the expectations of the RFP for jail medical services. And I did break them down in the categories that are listed here to the left, and so we'll go through those categories. So category 1, sufficiency of staffing. It was scored and ranked at 30%. And so sufficiency of personnel, administration, and healthcare services. And I want to talk to you about what is the definition of sufficiency. And so I looked this up, and the condition or quality of being adequate or the quality of being enough. And I want to say that we have over 800 local employees that are trained. We have strong administrative leadership that's local, and we have years of healthcare experience, both taking care of people in our community, but also incarcerated individuals. And we have many board-certified physicians. I think Madeira Community Hospital exceeds sufficiency, but I want to share more details of the requirements. If you look at category 1, the sufficiency of personnel, this is the list here of the required healthcare services that must be provided in the jail and the juvenile hall. Madeira Community Hospital's physician and staff are able to provide healthcare services anywhere. We've provided healthcare services in many different locations, and the jail would just be another one of those locations. Our proposed medical director, again, is triple board certified, and our ER director is board certified, and they are key medical providers for jail health. Madeira Community Hospital has 48 years of continuous experience delivering licensed and accredited healthcare service in all the required areas. And we have more providers and staff locally available to meet the needs of jail healthcare services than any other vendor. So going on with category 1 was sufficiency of administration. I just want to tell you that administration, we're here in the room. We have our board of directors, you have me, myself, and the CEO of this hospital. We're available 24/7. The buck stops here locally with me and our board of directors. We have proven our capability for healthcare quality and safe patient care. We work every day to meet or exceed regulatory and accreditation standards. We are licensed by the California Department of Public Health, and we're accredited by the Healthcare Facilities Accreditation Program. We have studied over and over the National Commission on Correctional Healthcare Accreditation Standards, and we are confident that Madeira Community Hospital will earn this accreditation. Category 1, sufficiency of healthcare services. Again, we have 48 years of dedicated access to care in Madera County. Madera Community Hospital's integrated healthcare system is qualified to provide emergency primary specialty medical care to all the individuals of the county, including jail medical services. We have nearly 3 decades of experience in coordinating outpatient care based on Title 15 standards, working in conjunction with correctional staff. We know healthcare is a fundamental right, and there's no limits to access to healthcare services with Madera Community Hospital as a jail healthcare contractor. There's no limit to access with Madera Community Hospital, again, as a contractor caring for those patients. This is a copy, what's in the proposal of our staffing plan. It was category 10 and weighted 10% on the scoring. And I want to say that our staffing plan is based on the accreditation standards. We took into consideration the staffing plan of the current contractor and adjusted it to meet the National Commission on Correctional Healthcare Standards for staffing a jail and juvenile facility at the size of Madera counties. I want you to know that we took this serious. We are confident that we would be able to provide adequate staffing for providing jail healthcare services to the jail. This is a minimal staff plan based on the population and the acuity, but we take quality and safety very serious, and we adjust our staffing plan as the needs arise because potentially there might be a higher acuity patient in the jail that would need more staffing, and of course that's what they would get. Category 3 was 30% of the weighted score, and this was the cost proposal. As you can see here, over 3 years, what the cost proposals were for all 3 vendors. I want you to know that we did extensive research in developing our cost proposal, including speaking with the NCCHC, which is the National Commission on Correctional Health Care, and using their matrix on how to establish a competitive and sustainable funding proposal. We are $1.3 million less than the selection committee's recommended vendor, and I want to assure you that we can provide quality care at this cost. The only thing I can say about the major differences between the funding proposals may be the overhead cost passed on by a national for-profit vendor versus a local healthcare service provider who has lower administrative costs. Category 4 is experience, and 15% was a part of the scoring matrix was based on this. It was relevant correctional facility experience of key staff. And I'm really happy that I'm able to talk and showcase to you about our experience in this area. Madera Community Hospital has more than 20 years of providing care for both the incarcerated in both the inpatient and the outpatient setting. We are currently the jail safety net provider. Madera Community Hospital has many years of experience treating inmates that are sent to us by jail medical services. In the next slides, we demonstrate our years of experience with correctional health care and how our correctional facility experience relates to the jail. So you may not know this, but we have an 8-bed locked guarded unit inside of our hospital for inpatient incarcerated individuals, and it is licensed and accredited. This here to the right is our list of active healthcare contracts that we have contracts with for incarcerated individuals. Now, mind you, these are all prisons. But, you know, whether a patient is in the prison or a patient is in the jail, again, providing medical services is providing medical services. And we can provide those services anywhere. I work very closely with all the administrative teams and the physicians at the local prisons, and we have excellent communications with this. And I do want to say that with the passing of the AB 109, that jail medical services are changing. And some of the reasons that they're changing is inmates are staying longer in the county jails, and so to help with the overcrowding of the prison. So, you know, as we talk today, things are changing, and we change with those things and make sure that we are able to meet the requirements to provide excellent and safe health care. The next few slides just goes over our qualifications and experience and providing, and this could be whether it's a prison or a jail patient. These are emergency department visits. And these slides, the next few slides are about our experience, and they go from 2015 to 2019, I think it was May of 2019. It really does demonstrate our experience on taking care of incarcerated individuals. Starting with our emergency department, we average more than 50 incarcerated patients each month. These incarcerated individuals present with different levels of acuity that we tend to. On a regular occurrence, our emergency department providers are conducting initial screening assessments of individuals before they are accepted into the county jail. These are our surgery visits, so you can see many of the correctional, mostly these are prisoners from prisons, and you can see our numbers are increasing there, but we have many of incarcerated individuals coming into our facility to have surgeries. Again, our 8-bed locked guarded unit that we have in our inpatient side, you can see that we have experience taking care of inpatient incarcerated individuals as well. And again, lastly, our outpatient and specialty visits. I would say that our doctors, our nurses, and our administrative staff all have healthcare experience in dealing with incarcerated individuals. And you can see our numbers here. And we do see some specialty patients that come from the jail in our specialty clinics. I also want to reference here that we do have some references from our partners from the prison, and we do have a couple of letters of support for Madera Community Hospital. We did discuss that we were putting in a proposal. They were very excited about it, and they were very happy to support us and give us a letter of recommendation. And I have those letters available to you if you'd like to see those. I think a couple of them are in your packet, actually. And lastly, category 5 for the scoring matrix, qualifications and experience of key staff. I just want you to know that we surpass the required qualifications and experience of key staff. We can provide medical care anywhere, and we do. I am personally experienced with the delivery of jail health care, and I'm personally responsible for the quality and the care provided at Madera Community Hospital, and I take that very serious. Dr. Rashidian, our proposed medical director, is Madera Community Hospital's inpatient medical director. He is caring for the inmates in our hospital now. Dr. McGovern is board certified in emergency medicine, and he does screening and caring for inmates in our emergency department every single day. We have extensive experience in providing care to behavioral health patients, our 5150 patients in our emergency department, while the patients are waiting for placements. And I do want to say, on a personal standpoint, I am a family nurse practitioner, and I myself have experienced working in the Madera County Jail. At one time when I was working as a nurse practitioner, and by the way, I still work as a nurse practitioner in our clinics in the evenings, I actually worked for the jail, and I went and did sick call at the jail. So I have firsthand knowledge and experience of taking care of inmates in the jail setting. And I want to say that it was really not much different than taking care of patients in our clinic when I did the sick call. The patient fills out a request for medical services, and they have a complaint, whether it's a sore throat, pain. We deal with that complaint. We write a prescription for the medication. We make sure that the inmate is taken care of. We look at their past medical history. And I've had also the experience of just seeing how the jail is ran for medical services. I was on call for after hours and night for the patients of the Madera County Jail when I did work there in the evenings doing jail sick calls. So I personally have some experience. So I don't want you to think that we don't know what we're doing. We do know what we're doing. And I want you to have confidence in what we're doing. We do this every single day. Taking care of patients is what we do. So this really does wrap up the scoring matrix. It's really unclear to me why Madera Community Hospital was scored the lowest when we have all the qualifications and experience needed, and our cost proposal is $1.3 million lower than the selection committee's recommended vendor. Madera Community Hospital will meet or exceed the National Commission on Correctional Health Care's accreditation standards and the delivery of healthcare services for Madera County's Department of Corrections. Madera Community Hospital is the only vendor who has aligned incentives with our community and our county to provide quality care, efficient and coordinated care, and expanded access to the outpatient care areas. Madera Community Hospital offers the best value to the county. The reason that we have a better value for the county's investment, We can help further the county's public health and safety goals. We can help reduce the health-related recidivism by having the availability of the outpatient centers to see the inmates once they're released. We can eliminate inappropriate use of the emergency department, and we can reduce law enforcement burden by working together with the county on trying to assure that the patients get seen at the proper place. With Madera Community Hospital providing jail medical services, it really improves the economic strength of Madera County. Madera Community Hospital will contribute to spending public dollars more effectively, and in some cases, we will be able to reduce the recidivism. Madera Community Hospital's goal is to administer a jail healthcare program that furthers the county's public health and safety goals. Madera Hospital believes that we can give you a better value for the county's investment. When I studied the National Commission on Correctional Healthcare Standards, I learned what is expected from a jail healthcare contractor. I'm here today to assure you Madera Community Hospital offers all the features and benefits of the ideal correctional healthcare provider. We have a local administration. We can make timely decisions. We have local triple board certified medical director. We have integrated healthcare systems providing a medical home upon release. We have integrated electronic health records, and we have successful and continuous licensing and accreditation for more than 48 years at our hospital. The county money stays in the county. There's no other vendor that can provide Madera County Jail and Juvenile Health Care Services what our hospital can provide. In closing, we have showcased how Madera Community Hospital's proposal for adult and juvenile hall healthcare services meets or exceeds the selection criteria. Our capabilities demonstrates healthcare quality, safety, and experience within the incarcerated population. But really, what makes our proposal unique is our relationship. We are your neighbors. Madera Community Hospital has been a trusted healthcare partner for more than 48 years with the county. And if it's your vision for healthcare services, provided in the jail includes improving the physical and economic health of our entire county, Madera Community Hospital is the only vendor who can accomplish this vision. Our hospital is the only vendor who lives and works here and has a vested interest in improving the overall health of our county. Madera Community Hospital is your best choice. Thank you very much.
Thank you.
Do I stay up here for questions?
Yeah,
or-
I think we've got
Okay.
some questions already ringing in.
Okay.
Supervisor Rogers.
Yeah, just in examining the overall proposals, I just see a few open-ended thoughts here that really concern me. As far as the hospital's ability to provide health care, I have no question that you can do that. Health care at the hospital is very well done. My grandchild was born there. I've gone there in case of emergencies. My son's visited there when he was in a football accident. And so the first place we will go when there's an issue of emergency or health care would be Madera Community Hospital, because you've proven beyond a shadow of a doubt your ability to perform medical care for the community. That is a given. My concern is that when you evaluate each plan, there are about 6 open-ended thoughts here, and to me, open-ended contracts are a no-no in my life. Just recently dealt with one concerning a lease as an example, where they wanted me to just take their word for it that they were going to value the vehicle at the end of the lease like I wanted, but it's very open-ended and it's subjective and all of those things. So there are 6 specific areas where it's a little bit subjective and open-ended, in my opinion, on these things. One I won't deal with all of them. You've actually answered a few of them during your presentation. But the question of cost containment is really an important issue for us. We've dealt in the past with many vendors who came in and said, you know, we'll try to keep your cost at this, but no real plan to do that, and ended up paying more in the long run than the prescribed contract. And one of those areas, or a couple of those areas of cost containment that concern me, one is prisoner transport to offsite. In the case of x-rays and those kind of things. And then, of course, liability. Is there some kind of a thought to indemnify, and does the hospital take on some kind of portion of this liability where you're providing services? There is a uniqueness of the clients, as you're well aware. The hospital specializes in serving the general public. That's been your specialty, even though you have, in part of your services, have served prisons and what have you. Your part of your experience is there. But there is a definite uniqueness to our clientele and a propensity for big issues. We had one gentleman who slit his own throat, and we were incurring a significant amount of liability there dealing with this guy. I'm sure Manuel's shaking his head. I remember that guy very specifically, and the only reason he didn't die was because he collapsed and folded his chin down to his chest, and it kind of shut off the wound a little bit. But just demonstrating the uniqueness of this clientele that we're dealing with, the mental health issues and the suicide and the liability in all of that is huge. And as I look at this, do you have a plan to contain the costs in those areas? You have you stated in some of your proposal that you will develop a plan, and that just kind of gives me an open-ended thought there. You will develop a policy, a procedure defining mental health screening and evaluation of all inmates. You will develop this, a system for dental services and a plan to respond to needs. You will develop and implement a written detoxification protocol. And you understand what I'm saying? It's kind of feels open-ended there, so can you address that?
Yeah, I can, yes. Well, of course, when we did our proposal, we're not at the county jail right now, so of course we don't have developed policies and procedures, but we have developed many of those policies and procedures already, actually. But again, you know, when we go and take over the jail medical services, just like when we take over any other service, the accreditation body requires that you develop those policies and procedures. So we took those specifically from the accreditation handbook on the accreditation for jail healthcare. And what I want to say is, of course, we don't have those established. We have to develop those because as we go out to the jail and we follow all those standards that are listed in the proposal, those are all the standards that are required from the National Commission on Jail Healthcare Services. So of course, all of those will be developed if Madera Community Hospital, and they will be developed on day one before we will set foot into the jail. Many of those policies we've developed already, and many of the programs we've researched and are ready to implement out at the county jail. So because we don't do those services today, we can't just take what we do at the hospital, of course, and set it inside the jail. We understand there's a huge difference in providing jail healthcare services. And we talked about those risks, and we want you to understand that we know those risks. You think you have a lot of risk over there at the jail. Mm-hmm. Well, you should be in our emergency room on any given day because, you know, it's almost 10 times worse than what we encounter at the jail. And because we do get patients that are there, and we are the safety net of the hospital, many of the 5150s and the suicidal patients are sitting in our ER, and we have to monitor and care for those patients until they can get get a safe transfer to a behavioral health, that's what they need, or until we can medically get them cleared, or their drugs and alcohol wear off, because many of them are drug and alcohol related. So when you talk about the risk, we want you to know, and that's why in my presentation, I wanted to make sure that you understand, that we understand those risks. And with all that being said, we still provide a much higher level of care. And so we know how to take care of patients. We understand what's required. And how do you prevent from some of these things from happening? That's that screening process that we intend to do based on the national accreditation standards. Screen patients early on when they get admitted to the jail, because that's their biggest tool, is making sure that you're taking care of those patients when they get admitted into the jail and understanding what those risks are. The other really big benefit I think that we have is that our whole community has access to our electronic medical record. We would bring that electronic medical record to the jail medical services. And if an inmate is admitted into the jail, immediately at our fingertips, we would have access to that history of that person that's admitted to the jail. Many of these patients have been seen in our hospital and are in our clinics. In fact, when I used to do jail medical services myself as a nurse practitioner, many of the same clients when I went to do the jail medical services were the same clients that I seen in our ER as a nurse practitioner or in our clinics. And so again, some of the same inmates or patients are seen in all the same facilities. So we feel like we have better access and an ability to provide that care. I'm sorry if you felt like it was open-ended. It's not intended to be open-ended. We have a plan. We have policies. We have procedures. We haven't implemented them yet because we're not at the jail providing those medical services.
It's just an observation. It's not something you have to apologize for.
No, I just want to make sure that you understand our position, and of
Well,
course,
yeah,
we
you-
understand what needs to be done.
Right. And you have demonstrated, like I said, the ability to care for people. That's not the question here at all. It's just the uniqueness of the situation, and are we, is the county covered? That's something we have to, our loyalties have to be with the taxpayer. And are they covered in the event that there's a circumstance that's going to arise out of what goes on with MCH dealing with the population there?
Well, one of the things that I'm really passionate about, and I didn't really talk about it, but we started a community-wide collaboration meeting, and we've been doing this for about 3 years, and we have many local community providers that come to the hospital, and we talk about difficult things that we're dealing with in our county. Some of them are jail medical services, some are behavioral health patients, some are things that are going on at the hospital. Law enforcement comes. We have a lot of people at the table, and what I want to say is I'm very passionate about it, and what I'd like you to understand is that because of our passion, because of us being so local, that I could envision, and I hope you can envision, that the county, our healthcare in our county could be so much better if we had one provider providing both jail medical services and the hospital services. I know it's something that's not been done before here in this county, but I want you to know that we have experts, we have great experienced doctors, we have board certified doctors, we're accredited, we're nationally certified. We continue to work towards excellence in our organization, and we would bring that same excellence to the jail. And when those patients get seen in the hospital or they get seen in the jail, we would make sure that we had a really great discharge plan to make sure when those inmates left the jail that they had an appointment with their provider in our community. And that we hope that our patients in the inmates, the patients, the people that live in our county, the underserved inmates, that they get the medical care that they need, and that we could work with behavioral health on really improving the mental health and the medical health of our whole county by really working together in a collaborative way. That's what we're passionate about. We want to be more collaborative with the county. We want to be able to, show to you and to our community that we could do better. There's many projects, there's many grants out there that we could apply for if we take this next step and really doing a community-wide collaboration, not just with our community, but also with our jail medical services and behavioral health.
Can you address any thoughts you might have on cost containment where prisoners' transport is concerned, and some of the services that were provided on-site would be provided off-site now, that would shift some of the cost to the county, in my view of things, because we would have to have personnel involved and off-site, and then we have to have somebody to take their place at the jail at the same time. If that, am I right on that, Chief? The circumstances right? You have to have a certain number of personnel in place to deal with the circumstances. Can you address that for me?
Sure, I'd love to address that. I totally get what you're saying there, and I understand the position of the jail custody. Every time, it's the same with the prison, the same with the jail. Every time they bring somebody to the hospital, it takes, a good amount of people to get them there, plus transportation. Our goal at Madera Community Hospital is to bring as many services to the jail as possible. We want to decrease the amount of visits to our hospital. We want to provide more services, and we believe because we are local that we're able to do that. For example, we have over 23 specialties that are in our specialty clinic, and instead of an inmate coming to our specialty clinic, we would send the physician out to that inmate and let them take care of the services there inside the jail. We believe that we have the ability to do that. Our doctors work with us very closely. In fact, all of our physicians, we've kept them in the loop on us applying for this contract, and they're very supportive in helping us make this work. So, we understand what that means. As far as x-ray services, we have a portable x-ray machine that we would bring out to the jail. We would try to do as many x-rays that we can do there at the jail and not have to transport people for lab, for x-rays. Of course, as many things as you can keep in that jail, we understand the importance. And we do not want to cost the county any more money. In fact, quite the opposite. We want to help you save money. And we hope as we go down this road that we would be the vendor that would be able to do that.
Thank you.
Supervisor Wheeler?
Yeah, thank you. Thanks for your presentation, too. How many county employees do you think you have there from the county?
How many what?
County employees, you live here in the county, you're employees of your...
Residents that live, that work for you, county
At
residents.
Madera Community Hospital?
Yeah.
I looked at that number. I think about 60% of our employees live in Madera.
60?
It's 65%. Me and our HR director looked at those numbers not long ago.
Did you say 50 or 60?
60,
60?
yeah.
Okay.
So we do have quite a number of employees, especially licensed staff that come from Fresno that work in Madera. But a lot of our other employees live here in this county and work here.
Yeah. What, have you ever bid on this before this last time?
No, this is our first time putting a bid in for jail medical services.
What made you decide you want to do that?
Well, we've had some frustrations, and again, our passion about providing excellent care to our community, to all community members, really prompted us to put a bid in for the county jail medical services.
Okay. Do you do dental at the hospital? That's part of this. I see on here on the dental services, you will contract with somebody or hire somebody. Do you have dental there now at the hospital?
We don't have a dentist working at our hospital specifically, but I do understand dental services at the jail. There is a place there to provide dental services, and they use a local dentist, and our goal is to continue with that local dentist. I'm sure that, we haven't contacted them, but I'm sure they'd want to continue those services. But there is other dentists in the area that we can contract with if they decide they don't want to do it. I do want to say that the only dental that we really do in the hospitals, many times we get dental emergencies both in our clinics and in our emergency department, and we deal with those dental emergencies from a medical standpoint. Many times they need pain medicine and they need antibiotics, and we deal with those emergencies every day in our ERs and sometimes even in our clinics. So that's our extent of our dental experience.
Yeah,
Most dental entities are not emergencies, so.
Yeah. I was writing a lot of notes, so I didn't quite, on that slide, you had, I think it was like 12 or 14 different correctional facilities and jails that you worked with. Does that mean you do work with them, or what was that? I don't know if you want to.
We are contracted with all those prisons that they're listed there, and they bring their inmates to us.
All those, they're bringing inmates?
Yep, they bring them to our emergency department, surgery. If they're sick, we admit them as inpatients. We see some of them in our rural health clinics and outpatient. Some of our community physicians also see some of those inmates in their offices. So we're very well versed in taking care of correctional type patients.
You got a mental facility there at the hospital?
We don't have a mental facility, but our ER is impacted with mental health patients every day. We are not licensed as a behavioral health, and we're not licensed as a mental health facility. Madera County, in fact, does not have a mental health facility. So any patients that are having a mental health crisis, they come to our ER, we house them there, stabilize them until they can get shipped out to into a inpatient facility. We work very closely with Madera Behavioral Health. Madera Behavioral Health comes into our ER. They help us to place those patients into a higher level of care. What we do is make sure that they stay safe while they're in our care and that we address any of their medical needs that they have. Once those medical needs are cleared, then they're okay to be released to a behavioral health facility, but we have no behavioral health facility in our county right now.
And
So we are the default.
Yeah, and X-ray, have you got a portable X-ray?
We have about 4 different portable X-ray machines at our hospital.
That you can take out? to
Absolutely.
the- Okay, and then let's see.
And we have a PAC system so that we can immediately get the X-ray image up on the PACs for physicians to look at it and treat the patient.
Okay,
Can I piggyback off one of your questions there real quick while you're looking at your next
okay,
question?
go ahead.
Yeah, what is your plan to deal with the mental health issue? You're going to contract with a clinician? How are you going to deal with that?
So we would hire a mental health professional to work in the jail, as it's in our proposal, and work with the behavioral health unit, contract with them to provide the behavioral health services inside the jail. We understand how important that is. That's why I wanted to talk about that a little bit today, because we know when an inmate comes into the jail, it's just not their medical that we're dealing with. We're dealing with their mental health. And we deal with that every day in our emergency department as well. We screen patients every day for suicide. We screen patients for mental health conditions because we know it affects the overall person. And so, we don't want to leave any stone unturned when we do an assessment of a patient.
Yeah. What do you think, I mean, you gave us a lot of stuff already about why you thought you came out so low on some of these categories and stuff. Why do you think it came out so low at 17% compared to 28 and 33%, just overall?
I was really baffled by that as well, as I wanted to showcase in our presentation that we, in my opinion, meet and exceed the expectations in those 5 different categories that we went over. I just, I don't know medical services are different, and providing medical services in the jail takes people that are qualified, and I believe that we have the expertise and the qualifications to take care of those patients that come through the jail, because we do it every day. And, the only thing is that the people that were, on the selection committee, there was nobody that was medical. Maybe they didn't understand. I don't know. I can't answer for them. Yeah. But I did notice that there was not one person that had a medical background, not one physician, not one nurse. And so I don't know if that's part of it. I don't know if we're looking at medical services or we're looking at overall experience in custody, because we're not custody, we're medical, and there's a difference there. The custody is handled differently than the medical, but we do work in coordination together to make sure that we are taking the best care that we can take care of the inmates that are there in the jail. So they did not share with us the scoring breakdown on where we failed. That's why I really wanted to take the time to go through that scoring matrix, so you can understand that we feel very confident that we meet or exceed all the expectations that's in that proposal, and especially in that breakdown of that scoring matrix.
That one chart you had on there, I think you had three charts on different visits there from different portions. I think one was operations, and I don't know what the other one was.
Oh, yes.
You had that one spike up to 120 at one month in that year. I think it was 17, I believe. Mm-hmm. What would that be? I mean, it was pretty even all the way across for 5 years, but that thing up there was more than 10 times.
So what happened is, I can speak to that, is one of our prisons, the local prisons in Chowchilla, they lost their contractor for x-rays. And so they had sent almost 100% of their patients here to do outpatient x-rays, and that's that month that it spiked. They got a new contract back, and it went back to our normal.
Yeah.
So most of those patients most of those numbers are for our outpatient center, either our clinic visits or outpatient x-ray, so.
And is there a percentage of those that you think came from Madera jail?
There is some of those that come from the jail. I think the jail right now does most of their x-rays in
I mean, in all three of the charts.
Oh, yes, especially the emergency department. We don't admit a whole lot of patients from the jail, but sometimes, there is a really sick person that comes in that gets admitted. But again, people don't go to jail because they're sick, they go to jail because they've committed a crime.
Right.
So the patients
I
aren't
expect
coming
that.
in real sick, they're coming in. But, the thing that we do and what we do best is doing those assessments of those patients, making sure that we're identifying upfront those medical problems that might arise so that we can make sure that we can take care of those before they become a problem that needs to be sent out. So
Maybe they
again,
got real sick after they got in jail, realized where they were.
well, it's true. Sometimes that happens, but
I
that's
know.
why we do a really good assessment of those individuals. But yes, in that graft, many of those, again, probably in the emergency department, we see more jail patients than anywhere else in our hospital. We have seen some at our specialty clinic if they've needed an orthopedic doctor because they broke their arm or something like that, but most of them are in the ER.
On that cost proposal, I took a picture of that. Next time you give a proposal like that, I don't know about the other board members, I like to have a copy of it so I can make notes on it. I took a picture of the one with your bid on how much money it was, the cost proposal. What do you think it's because you're local and stuff like that, yours is that $1 million less? Well, I guess it's $1 million all 3 years.
It's over 3 years. I think, again, I was trying to figure out myself why ours was different, and we really did look at, like I said, we did a lot of extensive research, because the last thing I want to do is to come back to you and ask for more money.
Yeah.
We want to assure you that we did our research, and we believe that we can provide these services for the costs that we've presented there. So we're really about, cost containment. We are local, we're here, we don't have a big overhead of a big administrative team. Like I said, we're here, it's me, I take, this basically really
Take the
serious.
heat, huh?
That's what?
You take the heat, huh?
Well, I mean, again, I didn't put my cost in what I'm going to be doing for the jail when we get the jail contract in account or add that to the bottom line. It's just what we do. Our administrative team takes care of it. So we're local. I think we have the ability to do that without having a lot of overhead. And I think that might be the difference, so.
I'm not trying to speak for Dave, but I know when we see bids, when we get bids all the time for a million different things, and when you see one that's quite a bit lower like that, you always kind of think, why? How come? What's going on? So, and we, in the past, have not, on some contracts, I'm not saying this or any other one, but if they were really low, we looked at it, and I think that's the reason we're trying to do that today, is why we have to do, why we would want to not pick the lowest one,
Yeah, well, we're
Why did it come in so low? So,
I think it's the difference from a for-profit versus a not-for-profit organization with overhead.
Yeah.
I think that's the only difference that I can think of. So I
okay.
don't really have an answer to that, except that I want you to know that we've done extensive research on our bid. Again, the last thing we want to do, Mark Foot's here with us. He's our CFO of our hospital. He helped me formulate this bid. We've checked with other jails. We've looked at other bids and volumes and compared where we're at. Again, we had no idea what the other vendors were going to bid. We put in the bid that we felt was competitive and what we could do it with. The last thing I want to do is go to my board and say,
Guess what?
we're losing money every month. That's not what we're here to do. So again, we know that we did a really good extensive job in providing a good bid for the county.
Thank you.
Supervisor Rogers?
Yeah, just wanted to follow up on one question. You have well, you obviously deal with more people that have been incarcerated than I originally anticipated, because I was not aware of all contracts you have with other facilities. That's a really important thing. That's good. The people that deal with those people on a regular basis, do they have any special training? Are they a specific group of people, or are all of your staff dealing with these people, or how does it work?
So it depends on where the staff is working. Of course, the nurses and all staff that work in our emergency department have different training than maybe some of the nurses that work in the other departments. And so again, every day we deal with patients that it's really unknown what's going to walk into our emergency department. So we have to train our nurses to overcome that. I mean, the latest is, we do active shooter training because, now today in emergency departments, we're targets. And so we know that. And so we do that throughout our hospital. But yes, any nurses or physicians that are working in the jail medical services would have extensive training on how to take care of those individuals. And there's lots of courses out there and certifications. We would mandate that our nurse leader there get certified in jail healthcare services to make sure that she understands how to take care of those individuals that are in the jail and what is different about taking care of them. The other thing I think that we bring to the table is that quality and safety is huge on what we do every day. We want to make sure whatever we're providing and wherever we're providing it, that we're providing it safely. And so we would bring that same quality and safety policies to our jail medical services. So yes, those individuals would be trained before they step foot inside the jail to make sure that they are able to take care of those services. We've already actually contacted a few individuals that have lots of experience in jail medical care, and they're willing to come and work with us and take positions if we do get this jail contract. One's a nurse practitioner, and a couple others are RNs. And we also have some partners in other counties that take care of jail medical services that we've reviewed extensively what they do, and looking at our proposal to make sure that when we take this on, that we can do an excellent job for the county. So we've done so much research in this to make sure that we are going to do a good job. We would not take this on if we did not think that we could do the very best for the county, because you are our partners. We see you every day.
One area that might really contain costs, as you're probably well aware by now, is telemedicine. Can you just give me a brief?
Sure. So we do telemedicine right now in our rural health clinics, and we also do it in our hospital. We have a tele-stroke program. We have the equipment. Our EMR actually is set up so it already can do telemedicine. So we would definitely implement some telemedicine inside the prison, and so we think that, or inside the jail. And so we think that definitely is something that a lot of healthcare entities do. I know the prison does that as well. We do it currently for specialties that we have hard time getting access to care for, or getting those doctors to come to our hospital. So we're used to it. We have the equipment to do it. We're set to do it. We would bring that to the jail as well as needed.
Great, thank you.
And we have interpreter services as well for people that don't speak the language, and we have that service available.
Supervisor Rodriguez?
Chairman, I've been there on occasions, unfortunately, the emergency, and that place is packed. Really is packed, especially at night. What are you going to do as far as the increased workload? As far as, are you going to hire a lot more people? Because what I see is, you can barely handle what you have now, and there's long waits there. And then, of course, when the police officers have to take people there from prisons or from the jail, they're there a long time, and that's very expensive. But the point is, are you prepared to increase your staffing to be able to handle that increased workload?
Of course. None of the staffing matrix that I shared with you would be the staff that we were going to pull like from important services at Madera Community Hospital. This would be new positions, new FTEs that we would hire on. We could not take care of the jail medical services with the staff that we currently have. We would have to increase our staffing capabilities, and that's what we would absolutely do. And I just want to say something about our emergency department. I totally understand that emergency departments in America everywhere are crowded and impacted. And so again, one of the reasons that we think that we would be the best choice for the jail medical services is that we can help with that. Hopefully we'd be able to keep more people in the jail. We have more access to care. We have the telemedicine available. We have multiple physicians that are available and willing to come out to the jail to provide services there in different specialties. And we believe that, we would be able to help in that. But the other thing I want to say is that we did, on November 11th of this year, we have a new medical group. We hired Vituity to come in and provide our medical services in our emergency department. Madera Community Hospital understands the importance and the value of an emergency department in our community, and we are making some drastic changes in our ER, trying to really improve our service, not just medical services, but the customer services of anybody that walks through our jail. We're taking applications right now for community members to serve on a board to help us better our emergency department. And so even though it's impacted, and sometimes we can't control that impaction because of the fact that, we never know how many times or what hours everybody's going to walk through our door. And at one given time, 20 people at one time can walk in. And so that adds to the impaction. It could be, 3 o'clock in the afternoon and nobody there, and 6 o'clock, we have a full ER with 30 people walking through the door. And so it is unpredictable, but we are up to the challenge. We've made great strides in improving our patient satisfaction and our services in our emergency department. Dr. McGovern, he's board certified emergency medicine, and he's already doing homework, talking to some of the other physicians that are working right now in jail medical services. In fact, he sent me a couple of articles yesterday doing his research. We're prepared to take this on. We're 100%, I'm losing my words here.
We're making you talk a
We're
lot.
100% confident that we would able to do a really great job for our county.
I know, Supervisor Wheeler has one more
Just-
question,
A
then
lot of people don't have health insurance, so they use the emergency week as a substitute. And
That's
going
right.
to increase drastically in the future.
So one of the good things about that, just recently, is we did apply for a grant. It's called Path to Health in Madera County. And so that we're able to now see those individuals in our outpatient clinics. And so we're really excited about that. And we're signing patients up, and we're just starting that program. So hopefully that'll alleviate some of the traffic in our ER. Because if they go to the emergency room and you have emergency Medi-Cal, it will cover it. But if you go to our clinics, it wouldn't cover it. And so now we have that coverage in the clinics. So hopefully those people that are not truly having an emergency will be able to get health care, which is, we all know is better for the individual. So
Supervisor Wheeler.
Yeah, just one more. On the x-rays, you said you had portable ones, but in your proposal here, which I'm trying to go over some of the pages since I didn't have this before, standard x-rays will be completed off-site at Madera Hospital.
yes, we do have 4 portables, and our goal is to bring those portables out to the jail. I wasn't completely sure if we were allowed to do that at the jail services now, or if you guys used a outside vendor. But again, when we get there, our goal is to decrease the transportation back and forth to the hospital.
So you just didn't realize that? when
I
you
did
wrote
not
this
realize
proposal, Okay. And then on a dental care, the very next one, it says that they will, dental services inside include instruction and oral hygiene and all that. So each inmate requiring dental care will be seen under the direction and supervision of a dentist. But you said that you don't have one, you just have to hire one for that, right?
Well, what I said is that, and I know that we have a local dentist that provide those services now. We would hope that he would want to continue to provide.
So you-
We would contract with him to provide those services.
Oh, okay.
If he decided that he no longer wanted to provide dental services in the jail, which I doubt that will happen, then we would put a new dentist in there.
When you just answered that question from Max about the emergency room, are you going to have somebody there dedicated to the hospital to the jail, that when we have those emergencies, which can happen 24/7, to be able to pull off, if you got a room full of patients already in your emergency, will you have a person dedicated that you can send to the hospital right away? To the jail, from the hospital?
So we will have dedicated people at the jail to handle emergencies, and if they need to go to the hospital, then of course they would go
You
there.
have somebody at the jail all the time?
Yes.
24/7?
Not a physician, but we do have nurses there.
That's what I mean, a nurse.
And
or
nurses
something.
respond to all emergencies.
And they're trained in triage.
And they're trained in triage, they're trained in emergency management,
Everything.
Yeah, of course, yeah. They would respond to any kind of medical emergency that happens there at the jail. And again, they would do that assessment and triage that patient, determine if that patient needs to be sent to our ER. The really beauty about it is they can pick up the phone and talk to our ER doctor and say, this is what I have. We have telemedicine available. They could telemedicine the ER doctors. I mean, it's endless as the different kinds of things that we can do to really help the county better service those inmates there in the jail without having to send them out. But of course, anytime it's a safety risk or issue, they're going out because we're not going to take a chance, you know, and you don't want us to take chances. We don't want to cut costs when it comes to safety or risk associated with taking care of patients.
All right. What's terrible about being the chairman, you have to wait to ask your questions, so they ask most of the questions.
That's okay.
Which is good. I already got that, what happened in April, May, and June of 2018. Thank you, Carl, for that one. Just a couple, in your research, looking at this, have you found where there's a model like this, not with, you know, just a company that just does jail facilities? Have you seen where there is a community hospital or a local hospital that takes over the jail services? Have you seen that anywhere?
Well, and I did try to do some research on that, and I have not seen that. But one of the things that I did talk to somebody from Tuolumne County, and they had probably the closest thing that I could think of, and we actually did visit that jail. And, you know, they have a hospital, and they have rural health clinics like we do, and then they have their jail medical services, and they're really pretty advanced on the community involvement they have with the jail and their clinics. Again, most people don't utilize hospital services when they're in the jail. Most of the stuff is in the outpatient. And as you know, there's a lot of push for services in the outpatient area. And I think that's why, you know, we are the perfect a candidate for this jail contract, is because we do have so many outpatient services. So what I saw there with that county is that they really have an integrated and collaborative model with the rural health clinics, which, you know, I would see that we would have as well. So when those inmates get released from jail, they go to their clinics, they have an appointment built in before they leave, they apply for their Medi-Cal before they leave the jail so that we don't interrupt medical services. Because the worst thing that can happen is we release a patient from jail and they don't have a way to get medical services after they get released. They don't have an appointment. And so they get released, they come back into our community, and the cycle starts all over again. We need to break that cycle. So what we would like to see, and what I really loved about that county, and that's our vision as well, is that when an inmate gets released, that they do have a place to go, that they do have, you know, we can make that appointment with behavioral health if they have mental health issues. We can make that appointment with a medical doctor if they have some type of specialty need, or with our rural health clinic for family practice if that's what they need, so that we can follow them in hopes that they continue to get medical care and that they don't end up back in our ER or, you know, without medications, and then they, you know, commit another crime and end up back in jail. And so we do know that there is a cycle. We'd like to break that cycle. We'd like to work with the county on how do we establish ways that we can break those cycles and really improve the health of our community together. And so that county is really doing that. But their hospital's not owned. Their county owns their clinics. And so the county is really involved because the county owns the clinics and the county runs the jail. And when I talk to the people from custody, and I talked to the head person that oversees the jail there, because we went there and visited. I mean, they loved how it works. They said it's been fabulous, it's great, and they had nothing but really great things to share with us. We got to walk through the whole jail and see exactly inside the jail and how they're doing things differently. Then we got to walk to all their outpatient facilities, and they have so many more than we do. And, you know, those are things that we can do together and grow, because, you know, they have a place if you're homeless that they can send those individuals. They have a place they can send them if they have mental health needs. They have their clinics they can send them if they have medical needs. We are missing some of those key things here in our county, and I know that, you know, we're working on all those things because we work with all the partners here in the county, and I do believe that will all be integrated together, and Madera Community Hospital can be a big partner in that, in helping
I
bring
like
that together.
model, but I can assure you that we may run the jail, but I don't want to get involved in running clinics, so you guys are, we're off limits on that. We're not going to be competing with you.
And we're not asking
Yeah,
you
yeah,
to.
we never will. We don't. I think you had answered the question about if this was going to take away services from other areas, because I don't want to take away from services that are going to the community. I appreciate that answer. And the cost of onboarding and training and everything is going to be the highest in the first year, and that's obviously the lowest contract year for you. How long do you think it's going to take to ramp up, to get ready to go into there, and so that there's a seamless, there would be a seamless transition? How do you see that happening? Because that would be important, that we couldn't have any change in care even for one day, because that's when you're the most vulnerable. So how would you see that happening?
So we would use, of course, we would set up some meetings with the custody department at the jail and really ramp up and get ready to provide the services there. Like I said, we're already started working on policies and procedures, getting ourselves ready to take over the medical services there. We wouldn't want the services to go without interruption. We would work with the current group to make sure that that happens, and that we could hopefully have a smooth transition between the groups. We just did that with our emergency department, and we did it quite well. And we would use a consultant person that we've been reaching out to help us prepare and get ready, and experienced providers that currently work in the couple of them that we've been talking to work at the Fresno County Jail, and so they have experience in providing healthcare services in the jail, and we would use them, and they would be the ones training our staff because they have that experience. I would be boots on the ground myself in that jail, making sure of a smooth transaction as well. I have the experience. I am still practicing, and I understand the importance. And again, I take it very serious that we're putting in this proposal to take care of jail medical services. We don't take it lightly. You will have our full attention with our medical directors, our physicians, our administration. We will use consultants. We will make sure everybody's trained. We'll have dedicated staff there in the jail that are trained to provide these services.
And if the cost of onboarding is higher in that first year, you're prepared to?
We're prepared for that. We understand that the cost of doing business and onboarding new providers, we do it every day. We deal with it every day in the hospital, and it is expensive. And so that's why, we want to make sure that we can keep our staff, that we pay them fairly, that we have good staff there. It's really important to us. We recognize how important the people that we hire and doing the job is to help us be successful.
And speaking of the people that, even if these are national firms, the other, they're not national employees. They're not flying in from wherever the home base is. They're here local. They're still local employees. Would there be hiring preference for those employees that have already done that?
Yes, we did put that in our proposal. Our hopes is to keep everybody that's working currently there if they're doing a good job. Some of the nurses, I know a couple of the nurses that used to work at Madera Community Hospital that now work at the jail. And so again, Madera Community Hospital for Fresno and Madera and the Central Valley, and sometimes even the Bay Area, we're the training grounds for many new nurses. They come to a small hospital. We're considered a small rural hospital. There's bigger hospitals all around us, and people come there because they can't get jobs at the bigger hospitals because they need experience. And so we train a lot of new people. We get that, and that goes for the jail as well. And so our hopes is to not disrupt things. We don't want to be a disruption. We want a smooth transition. We want to be able to hire and retain those employees that are living here and working locally, and we know that there's a lot of them that are there. And so, yes, we think that's the best model.
And I just have two last questions. With the mental health, I saw in the staffing plan, you had half FT for adult, half FT for juvenile. Obviously, that's one person. I think we would find in a daily population between the two of over 500, that the percentage of mental health issues that are in that population versus the overall population of our county is going to be a lot higher. and much more severe mental health issues. That's probably one of my biggest concerns is this mental health portion, because in that continuum care that you were talking about that goes outside of it, and making sure that those people are followed and helped to get the help that they need during the time. That's where I see that there's not enough weight, in my opinion, just having dealt with a lot of different, I've spent more time with mental health services than I ever expected to understand. And that's a part that I think is light. And so the one FTE, what did you propose, or what level of clinical experience would that person have, or what would that person be, and how would they manage that population and the mental health issues there?
So when we looked at that proposal, we did split it up, and we did base it on what was currently at the jail medical services. Again, not being there right now to know the needs of the mental health population in the jail, and it changes daily as your admits come in, and we understand that. Again, it's a proposed staffing plan. Our staffing plan would be what is needed for the jail. We would have the required number of staff members, and if it was more than what is there, of course, again, safety is the utmost important to us. So if you had a big, high-level number of mental health patients that are coming in there, we perhaps would have more staffing. No different if you have a higher level of inmates coming in and you need more nurses. We wouldn't just say, you only get this one nurse. But, there's more volume, or maybe a higher acuity of patients because you have somebody maybe in your infirmary care that needs a more one-on-one. Our staffing plan would adjust based on the needs there at the jail. So we do know that behavioral health is very important. We do have licensed clinical social workers that work with us. We also have nurse practitioners that are trained in behavioral health or mental health disorders that can actually see the patients. Our nurses will also be trained in some of the behavioral health aspects of providing the care. So it wouldn't just be one person. The overall assumption for our nursing, or the overall training that we give to all the staff that's there is that, they will be trained also on how to recognize a patient that's at risk for suicide, and do all that training with all of our staff. And so we would have the required staff. I don't want you to think, again, that's a proposed staffing plan. It really depends on the needs of the clients. We're going to have as many staff members as we need to provide safe and effective care at the jail and provide excellent care.
And then the last one, just to touch on what everyone else is in terms of the cost containment. And this has been a question I always ask whenever we have contracted services, just like when we contracted out with our county council, was, how do we ensure that, or what are the safeguards that this isn't just a way to funnel into different areas? I'd asked our county council, what safeguards do we have that says, you're not just taking every single case that comes to us. And in this case, what would the safeguards be just to ensure that, every person that you see, there would be a higher level of billing if they get admitted into the hospital, that, all of a sudden those things that maybe could have been treated there don't get taken there. And I did hear your answer in that it actually takes away some impact from your emergency rooms to triage most of them there and not bring them in there, and that's actually a benefit. But because the county would be on the hook if that patient is taken from the jail and admitted into the hospital at a higher rate. Is that correct?
Well, it's not really correct because, well, first of all, we can't admit a patient that doesn't qualify for admission, and there's lots of categories of different qualifications for admitting a patient to the hospital, and they have to meet basic criteria or nobody's going to get paid. And so, no, we would never do that. That wouldn't be ethical, first of all. And, again, it's never the best thing for a patient to be inside of a hospital. We always want to keep patients out of the hospital if we can, because that's better for the patient, of course. But, again, when we provide care, we're going to do the right care at the right place. And we have to look at each individual and each case. But again, our hopes is that we can provide the care there at the jail and in a very safe and effective way. Our goal would never be to bring that patient to the hospital. And besides that, part of the county contract is that we're responsible for all the care, even if the patient is admitted to the hospital. So it is important that we can contain those costs within that proposed amount that we have proposed. So we understand what's our responsibility, and our responsibility as part of the contract is to contain those costs, and that's what we would do.
Great. I appreciate that answer. So it's safer to keep people in jail than in hospitals.
No, I don't mean it like that.
No,
My
I know,
point
I know.
is everybody knows that it's always better to be, nobody here wants to be in the hospital, so unless you need it, it's great we're there. But if you can treat something as an outpatient, which everything is moving to an outpatient setting, and again, all the healthcare insurance companies, they decide based on certain criteria, if the patient meets that criteria to be admitted, they can be admitted. If we admit them and they don't meet that criteria, guess what? We're not getting paid for it. And so again, we have some software that helps us to determine if a patient's going to meet a certain criteria that every hospital uses and all the insurance companies use as well. So everybody's on the same page with that. So
I appreciate that clarification. Healthcare changes every day.
It does.
And the billing and everything, it's as complicated as can be. So I appreciate that. I think we have one more question from Supervisor Rogers, and then we'll wrap this one up, and we're already behind schedule.
Yeah, just, I wanted to corroborate something you said earlier, and I gave it some thought. You talked about the difference between the three bids and that you were lower. And the overhead was something you mentioned. And I think that that's very plausible because when you look at overhead, 25% is an average in there somewhere in there. It doesn't always fit that bill, but that's a pretty good rule of thumb. And so I thought that was very telling. It really kind of resonated with me, so I wanted to corroborate that.
well, thank you.
Yeah.
All right, and thank you
Thank you
very much
so
for your
much.
presentation.
I gotta go to the bathroom.
Okay, we're going to take a 5-minute break, so we'll get started with WellPath at 10:20.
Phil.
There's a few things to usually get excited for. Baby weddings and graduation. We stayed, yeah, my aunt lives in Fresno, and then my wife's family the day after always in Florida. So we're able to, what's nice is all of our holidays kind of line up where she likes to go the day after Thanksgiving to hers, and mine is the day out, so we don't have to leave anybody's early, so which is always nice.
Did you guys do much cyber shopping?
So my wife and her friends we're supposed to, a bunch of them are getting together, play date for the kids today. They all chipped in on 2 babysitters to watch the 15 kids, and then all the moms are Cyber Monday shopping today. Yeah, they're all doing it on the laptop together with mimosas. And I was like, that sounds fun. She goes, oh,
The wife used to go shopping all the time, Macy's and all those stores in Fresno. Now she shops online. Every other day.
It's not just Cyber Monday.
David?
Was I not on during the question? Oh, my.
All right, welcome back. And now we will have WellPath present their presentation for us.
Great. So I guess do we have a deck up here?
And maybe if we can go down the line and introduce yourselves.
Absolutely, we'll do that.
Great.
In fact, that's a good place to do.
Oh,
So, yeah.
your slide was already there. You're a step ahead of me.
I didn't want to just come up here and speak because I really wanted you to hear from people that do the work and care about the work and are passionate about this work. So I'm Kip Holman. I'm the president of WellPath. And,
I'm Amanda Gibson, Regional Vice President for WellPath here in the Central Valley.
I am Dr. Corinne Kotraba. I am the Vice President of Behavioral Health for WellPath.
I'm Devin Medina. I'm the current Health Service Administrator for the Madera County Jail Medical Department and the Juvenile Hall.
My name is Debbie Massetti. I'm the current mid-level provider nurse practitioner at the jail.
So, WellPath has been doing business here in California for 35 years. We'll get to that in a minute. But we focus on a few different things. First of all, the most important thing I would say is what we call the 5 Ps. We're very focused on our patients, our people, that's these folks, our partners, that's you, and process and performance. We have a mantra, which is always do the right thing. We've had that for 35 years, and we continue to do business according to that mantra. We've been caring for California for 35 years. We started in Monterey in 1984. We currently provide services in Madera. We've been here since 2009, about a decade. We have 33 counties that we serve in California, 14 in the Central Valley, and we have almost 1,700 employees in the state, about half of whom are in the Central Valley. We serve 22,000 patients every day, again, about half of those in the Central Valley. It was very nice to hear Ms. Pollinelli talk about Tuolumne County and the work that they do there. That's been one of our partners for decades. We also serve Fresno, which is neighbor to south, Merced, Stanislaus, Tulare. So we are very, very familiar with the Central Valley and the needs here in the Central Valley. I'm based out of our San Diego office. We have a full office in San Diego. And I think it's very important to understand that every partner we have in California is a reference. So those 33 partners, we only have 2 former partners in San Diego. Everybody else we've ever served is a current client, including Monterey County, who we've served uninterrupted for 35 years, many, many others. So our average tenure in California is about 15 years. So we've served our partners for a very long time. We also are a national company, as was pointed out. We are in 34 states. We have almost 600 facilities, about 300,000 patients a day that we serve, and we have about 16,000 healthcare professionals that work for us. Most important thing that does is bring us resources. So, for example, when we talk about NCCHC, we'll talk about that in a little bit later. That's the accreditation for jails. We have an entire department that focuses on earning and keeping those accreditations. We have training. We have technology that's second to none. We have all kinds of resources allow us to do this work effectively. We hire and keep great people. I noticed that about half of the scoring was based on staffing in some way or another. I think it should be 90%. To be perfectly blunt, the most important thing that you can do to be successful in one of these kind of programs is hiring and keeping the best people you can. We start very simply. We hire well. We're very dogged about the way we hire people. We train very well. We have constant training, and we pay well. Ultimately, the people you have in these facilities, it's not just their qualifications or their licensure. It's who they are and how they do the work they do. So we work very hard to get the best people we can get. And I'm going to let Devin talk a little about what that has meant here in Madera.
So as you guys know, this is our only job, so we do take it very seriously. We're a correctional-based medical company. And here specifically in Madera, we do have a decade of stability. I myself have been here since 2010. I did start off as a floor nurse and worked my way up to manager. Debbie Massetti, as you know, she's not only a provider in the community, she is also has been the provider in the jail since 1996. Dr. Gustavson, our medical director, who also has a private practice in the community, has been our medical director since 2011. Dr. Baker, our current psychiatrist, has been working with us since 2009 when we got the contract. And then Sean Ryan, our current psychiatric provider, who answers to Dr. Baker, has been with the company since 1993 and has worked in various other counties and then been with Madera since 2009, since we acquired the contract. I can attest to full-time staff. I first have no turnover. My full-time staff, my oldest full-time staff who's been there has been Ms. Massetti, who's been there 22 years. I have registered nurses who have been there upward of 20, 15. I think the newest full-time staff member I have is 2 years old, so I keep them.
And I think one thing I want to talk about is, Madera, we have, as an organization, we're a national company, we have every year 19 awards that we give across the country for 16,000 people. Last year, or this year, I guess, Madera, under Devin, won what we call the People Award, the 5 Ps. So we have a People Award, we have a Partner Award, we have a Patient Award. She won the People Award, and they won that award because of literally no turnover for almost a decade. And it is really important, again, that not just the type of people, but who you have in these facilities. We have had a team here that is about as good as it gets. And in addition to Devin and her team, I want to point out the quality of the team you have up here. So again, we have 19 awards that we give. Over the last year and a half, 3 people on this panel have won one of those 19 awards. So Debbie Massetti this year won an award for one of the 2 best providers in the entire country. So she won that award. She does training. She spends time across all kinds of sites working with our folks. She's about as good as they get. And then Amanda Gibson won one of 2 awards we give every year to our best employee of the year, again, across the country. So on this table, you have 3 people that won 19 awards here in your county. So it's pretty remarkable to have that kind of quality here in Madera. We do not miss shifts, period, full stops. That's been a commitment we've made since day one. Again, if you want to keep a jail safe, if you want to keep a jail low risk, the first and foremost important thing you have to do is to make sure that you fill every shift every day. We are dogged about that. And that starts with the way you budget for staffing. So you asked questions about why we're more expensive. I'll tell you the most important reason we're more expensive is we budget to pay our people well enough to keep them, as is evidenced by a decade of stability. We also budget a relief factor so that every person, if somebody goes on vacation, they're out for sick, for any reason they're not in the jail, we have somebody backfill. So we always have every shift full. Very, very important. And I'm going to let Devin again talk a little about how she's gone about doing that.
So I know you can see up here, it says we have a robust long-term per diem pool. So I know a lot of people, when per diem said, you think people like floats, and that's not necessarily how that is. My full-time, there's not really a difference between my full-time staff and my per diem staff. They're trained the same way. The mandatory trainings, they're trained by the full-time staff, so it's familiarity when they're coming in. You're dealing, the inmates are dealing with nurses that they've seen, that they know. Same with the juveniles. We recently started staff share, so because we are in a lot of counties, we have the ability to, all the way from Tulare County to Tuolumne, we can utilize nursing staff. And the nice thing about having it at that many sites is we're all trained the same. So it doesn't matter if it's a nurse from Tulare or a nurse from up north, Shasta area. We're all trained the same. We all know the same policies and procedures, which has worked very well because we have had to utilize nurses from other counties occasionally when we have whatever life has thrown at us. So I've never, since my tenure, have ever used a staffing agency. I know that's kind of a no-no. I mean, if it's needed, it's needed, but we have never had to use that. So we do what it takes. We don't miss shifts. I'm a registered nurse. I cover shifts. So if it's needed, I'm there. And I have very good staff who really step up to the plate and take on what needs to be taken on when it comes to that.
And again, I think it's remarkable that to not have missed a shift in 6 years, not one shift, is really a remarkable testament to the work that Devin and her team have done. Correctional healthcare is a very unique and complex thing. You heard earlier that healthcare is healthcare. I don't believe that to be the case. The reason you have companies like ours that specialize in this very weird thing is because it is very unusual and very different. It is not traditional healthcare. We care for a very, very medically fragile, high-risk population that suffer from many, many illnesses. And again, Devin, you can, or I guess, Debbie, you can talk to this.
Thank you. Yes, we do indeed care for and evaluate the most vulnerable patients in the most vulnerable time of their life. Most of these patients have had minimal, if no medical care prior to their arrest, and sometimes we are their first contact. Our assessments must be spot on. All of our nurses have some sort of specialized nursing training to work in a correctional facility. We see and assess patients under the influence of many different drugs, alcohol, and our assessments are critical. We have a great drug and alcohol detox program, so we can assess and treat these patients safely in jail without referral or transport out to the hospital. We have a strong and successful suicide and mental health prevention program to help treat these patients while they're in the jail, to help them transition back into the community. We work in collaboration with our correctional partners. If for any reason any of our correctional officers have a concern about a patient, they have instant access to well-trained nurses and qualified professionals to help in these unique situations. Jail medicine is very challenging because of the multiple unusual medical problems that are masked by drugs and alcohol. We can effectively manage most all of our medical problems on site. We have a very experienced and qualified medical director, as Devin alluded to, who lives in the community and is experienced in jail medicine.
Yeah, and you heard earlier, kind of saw the charts on the number of visits by people from corrections. So I can tell you that from the jail, we intake about 500 new people a month. So that's how many people come into the jail every month. And every month, roughly 4 times a month does somebody get sent to the ER for further evaluation, 4 out of 500. So it's a very unusual thing. We have very, very highly trained people to assess these these new inmates and to avoid that. Second thing is, once somebody is in jail, we rarely send somebody to the hospital. About twice a month does somebody go to the ER from the jail, and only about 2 days a month does somebody, or 2 nights a month does somebody spend the night in the hospital. Again, it's our job is to keep people in, and I think really important is optimizing on-site care. It is a key part of what we do. It's what we've done for decades. It's what we've done here for a decade. And again, this is, as people pointed out earlier, reducing the risk and the cost of sending people off-site is very important. It's not just medical cost. It is, in fact, the custody, the corrections officers that have to go with them. So we're very, very focused on that. And again, I'll let somebody more knowledgeable than me talk about that.
So again, we like to hit on this point of stable and reliable staff. We've shown we've been stable. And I'd like to hit on the assessment skills that Debbie had spoke about. Again, there wouldn't be correctional medicine companies if it wasn't a specialized area. The nurses that work in our facility don't have access to, we have on-call access at all times, but not as you would in the hospital setting. And so they have to be very good with their assessment skills. Again, we're dealing with a population who, like Debbie said, majority of the time, we're their first contact with any medical care. We run chronic care clinics within the jail. We see anybody with diabetes, cardiac issues, many infectious diseases, tuberculosis, pulmonary issues, and neurology issues. We do utilize Arista MD e-consults, which is a program that is sort of telemed-based, where we can consult with probably over 20 different specialties to be able to provide instant care direction to not only our medical director, but to our nurse practitioner as well. And then if needed, they do go off-site, like Ms. Palinelli did mention, and we utilize that. We also have IRMA care management, where if they do need to go off-site, we do have the ability to put that in, put all the history, everything about this particular patient, and then our physicians who manage that program are able to give us more direction or approve so that we can send people off. And then proactive inpatient case management. I know our mental health nurse Sean works with behavioral health quite often to get, especially the very sensitive inmates, the mental health care that is needed. We'll work with the courts sometimes to also do that.
And just a little more on Arista MD. So this is an application, actually it's more than 40 specialists or specialties with 80 docs. And you mentioned telemedicine. This is a way that when somebody is scheduled to go off-site, before they go off-site, we can actually engage a specialist to help us co-manage that patient so we don't have to send them off-site. We find that every time we use Arista MD, roughly 70% of those off-site visits are avoided. So again, we work very hard to try to find a way to do everything we can on-site, and that is partly why we've seen so few people wind up going to the hospital. Accreditation. Amanda?
So as part of a national organization, we actually have a unit dedicated to assisting with accreditations. WellPath accreditations by the numbers, just so you guys know. When you're looking at NCCHC and IMQ, we have about 80 sites that have that, and of the IMQ, about 90% of those sites are WellPath sites. So accreditation is something we do really well and that we fully understand, specific to correctional health care. Our providers and our programs, our processes, as well as our implementations. So full compliance with the standards established by the National Commission for Correctional Health Care, as well as ACA, PREA, CMA or IMQ, and California specific Title 15. We know what it takes. We know what needs to happen with the program, with the process, and what has to be fully executed, and the number of staff needed to accomplish the goals set forth by the accrediting bodies. And we are more than comfortable and will get Madera County NCCHC accredited. As you can see now, I believe you have the proposal now. We have added the staff in order to do that with the request from the committee for the NCCHC accreditation.
So again, our price did go up from last year to this year, and essentially that was all to add staff. And I'm going to let I guess Devin, who's going to talk about that? You? Okay, perfect.
So, because we know accreditation well, working and knowing what the body is looking for, the accrediting body, we added the additional RN hours to meet the NCCHC requirements, as the current contract did not request NCCHC certification. We cannot achieve the NCCHC without that staffing. We also added some additional psychiatric and mental health professional hours to address the increase in the number, as we've all experienced the acuity of our complex mental health and behavioral health patients. We have been providing that increased mental health staffing for more than 18 months uncompensated. And as we mentioned before, we have a number of counties surrounding Madera, and those programs have been instrumental in the implementation and maintenance of maintaining the care for those very complex and fragile patients that are in our care and custody in Madera County.
And to your point, that's, we did significantly increase mental health staffing for that reason. And speaking of, I'm going to let Corinne speak to that.
Yes. Great. So with our enhanced mental health services, what we've found is by partnering with some of our nearby counties to utilize additional assistance with our patients at Madera County, we've greatly reduced the amount of time that patients are spending in safety cells. We really want to keep patients as safe as possible, but also in the least restricted type of housing place. The additional mental health services would be focusing on that, as well as really focusing on the true mental health needs of the population that we're seeing. So there's an increase in the seriously mentally ill that we're seeing come into the jails. And with that, we focus a lot on the patient's true needs rather than focusing on medicinal interventions right away. So there's a lot of non-medicinal interventions that can be and are being currently used very successfully by our current mental health team, and the additional staffing will help further those services. For example, our mental health staff assist with getting the patient's California driver's license or ID cards, replacement cards for their Social Security services, so that they can have community wraparound services. We get them stabilized, we maintain them in ways by using evidence-based practices that are normed for corrections in particular. I myself have worked in the California Department of Corrections for 14 years, so I have the benefit of a lot of the services and the treatment protocols that have been tried and true for decades and decades. In addition, we'll continue to work with Madera County Behavioral Health for crisis intervention and things like 5150 or involuntary hospitalization needs. Other enhanced services. So currently we do some multidisciplinary treatment services and team meetings where we really focus on using all of our providers to the full scope of their licensure. We don't have doctors in charge of specific treatment team meetings as might be a traditional model out in the community. Instead, we really have all of our partners in the jail part of our treatment team meetings. That includes our correctional officers, that includes our nurses, our mental health providers, our physicians, because we treat the whole patient. That's one of the things that is incredibly important and is a strength of ours by having an integrated model. We've found, and we've worked in some counties where the health care is provided by one entity and the mental health care is provided by a different county or entity, and that fragmented care does lead to mistakes. And so it is a best practice to have this integrated care, which we're very proud of. Some of our focus is on trauma-informed care, recognizing though that it's in a jail. And so that is a specialized way of providing trauma-informed care, not knowing how long they're going to be there. Screenings and assessments is another really key area that we focus on. Again, we use evidence-based tools that are normed for corrections. And Debbie spoke about the suicide prevention. We have very robust suicide prevention policies and procedures. It is a national standard that we use, again, using evidence-based tools. And then telepsychiatry complements our mental health services, and those are available 24/7.
So real quickly, we have probably best-in-class technology. We talked about IRMA Care Management, or RISC-MD. We have an EHR that is fully integrated to all of the key things we need to use. We have a client portal with advanced reporting that I won't spend any time on in the interest of time. And then just, I want to kind of close by wrapping up sort of you as a board, when you met before to decide what to do, said that you wanted to understand kind of more in depth what the differences were and what led to the scoring differences. And I want to kind of wrap up by telling you why I think that we scored the way we did, and hopefully you'll support the selection committee in that. Again, starting with the team, you have the best of the best here. This team, all award winners. I don't know what it is about Madera, but it's like, Madera is to our organization what like the Dominican Republic is to Major League Baseball. I mean, I can't figure it out, but it's something amazing going on here. And you guys deserve to keep this team. It's a great team. We focus very, very acutely on optimizing on-site care. We talked about that, or you talked about that earlier with Ms. Polinelli. I think it is so important to understand that our goal is to keep people on site whenever possible. We work very hard at doing that. And in fact, as I said, 4 out of 500 people, we have so few people who go to the hospital for that reason. But we don't do that by cutting corners. And I think that's demonstrated by a couple things. First of all, the in-custody death rate in Madera County is dramatically lower than the state average by a lot. So you guys have a very safe jail here. Secondly, we've had almost no litigation. I think we've had one case, a $60,000 settlement in the last decade, just almost no litigation. And these are very dangerous places, high risk. Ms. Polinelli mentioned Fresno being under the PLO, which is a terrible acronym, but it is the Prison Law Office. And we stepped into that situation and have basically gotten them out of the situation they were in. So we're very good at running to trouble. We understand it. You aren't in trouble. Things are great here. But we understand what it takes to run to trouble. We are correctional health care experts. This is a very specialized thing. We do it very well, and we are also NCCHC experts. We understand what it takes, and we understand the nuances of this work. We have built in enhanced staffing, especially around mental health, because we understand the needs. You've heard time and time again that jails and juvenile facilities have become the de facto mental health centers in our counties. That is very true. So we understand that. Dr. Katraba is probably one of the leading experts in the country around this. Her background is all in this area, and she has continued to work with us closely here in California. She lives in California. She works in California. 88 cents of every dollar we spend stays here, and that's because mostly it's people. The vast majority of what we spend is on people. The people that work in this jail all live in this community. They are members of your community. They work in this community. We spend money on outpatient services, inpatient services, on-site x-rays, all that stuff stays here. We don't spend a lot of money outside. Mostly it's on pharmacy and some other things. And this team you have cares about this county. They are members of this community. They care about this community. And again, we urge you to follow the committee and stay with this team. We think you've got a great team. We hope you keep them. So that's it. Questions?
All right. Supervisor Roger, thank you for your the presentation.
Yeah, I appreciate the presentation. Thank you. And past service to the county as well. It's important to have good providers. You're a for-profit organization.
Yeah.
And you said a majority of your money stays locally. Explain to me how your profit stays locally.
Well, our profit doesn't stay locally,
Okay.
but again, for-profit doesn't, we're not Google, right? We're not.
Right.
Yeah, and so we don't have, whatever margins Google has. We're a healthcare services organization, and our margins are much less than what you would see there. So a lot of the money, so if you look at the margin, what we don't spend, so part of what we spend, I'd say, doesn't stay local, and that's on pharmacy and other things like that. But that's the case for anybody. The hospital, as Ms. Polinelli mentioned, uses a Oakland-based company to run ER. So we all do things like that. We need services outside. So we do that as well. But once you get to our margin, about half of our margin is used to spend on services that directly or indirectly support the jail. So people like Amanda Gibson and the people in California that she reports up to, that's all on that. And then, of course, we have a margin at the end of the day so that we can run our business like any business does. Right. And I think in the end, the only real difference between a not-for-profit and a for-profit company is we pay taxes. And that's really, fundamentally different. I mean, if you've been in healthcare a long time, as I have, you've probably heard the term no mission, no margin, no mission, right? So every healthcare organization has to generate something to support its business, and we're no different than anybody else.
What is your assessment of the difference in the costs between the three bids?
Well, the one that I would point to most directly is probably staffing. I think not just the number of people, but we work very hard to hire and keep great people. And so we pay what we have to pay to attract and keep really good people, and that's built into our cost structure. We also, as I mentioned, have a relief factor. And so when you take those two things together, in our experience, we probably spend, 15 to 20% more on people, maybe more than other people do. And that's been the case every one of these I've ever done. I'm very familiar with that process. Our turnover rate in Madera literally has been virtually zero. We just don't have turnover here. This is a very hard place to find people. So I think when you look at hiring 19 people and bringing them into this community, that's a difficult thing. We're fortunate that we have people here, and the people working in the jail that they bleed Madera green and Wellpath blue. And so the nice thing for us is that we have lots of places for them to work, but we also have lots of places to draw from. So I think Devin has told me many times that she has a waiting list of people who want to come work in the jail, who do per diem work or work in other counties. So she's built an organization that is a destination workplace, and it's shocking to think about a jail being a destination workplace, but she's done a great job of it. And I think part of that just takes a little bit more money.
So you feel that the assessment of overhead is the correct?
I don't know. I mean, I don't know what our overhead is relative to the other folks bidding here. I can't speak to that, but
okay.
Yeah, it might be part of it. I mean, I don't know, but.
Okay. I might have more questions.
Yeah, what was the first, I'm looking here, I don't have the cost breakdown.
It's
All right, Supervisor Wheeler?
Yeah, thank you. The questions here. Should have been thinking about that instead of looking at that cost breakdown. How many people you think live in Madera County that work for you? Half, 20%?
Out of my full-time staff, I think all of them live in Madera County.
That's 19 of them, you said?
Yeah.
Okay. And how long have you been doing,
11 full-time.
I have 11 full-time staff.
Okay, and how long have you been doing this for us, Madera County now?
10 years.
10 years? And you have a mental health facility, like you said, right on, is that one of you? That's you. You live here in Madera?
Yes, we do the mental health services right in the jail.
Okay, and you work for them, or do you?
Yes, we're all one team.
Oh, you are, so you're not contracted outside labor company?
No. I'm a vice president of WellPath and over all of behavioral health services.
Oh, okay.
Yeah, so it's an integrated team.
So Dr. Katraba does not work here in Madera, but we have mental health professionals who do live and work in Madera.
Okay, and how about your x-ray services? X-rays,
X-ray service is a contracted service. They provide services in various other jails, Merced, I know us, I believe Fresno.
They are a specified company that does these kind of things all over?
Yes.
Okay. And let me go down the list here. I guess that's all I have right now.
So in terms of the accreditation, that was just brought up in this RFP process to get that. Why hasn't it been done before, over 10 years? What's the importance now? Would you have done it with or without the recommendation through this process? I think
that would be the question to me.
Yeah. First, I'd like to know if they would have done it otherwise, and then Manuel, then you can provide that.
So I would say that, first of all, every facility we operate operates under NCCHC guidelines, whether we have accreditation or not. We work under those guidelines. So again, we're very familiar with them. We do hundreds of these. We know how to do that. So we have, as you saw, we have something like almost 90 NCCHC accredited facilities across the country. We have another 28 in California that are IMQ, which is California's version of NCCHC. But that would say, because we have close to 300 county partners we work with, so we have many that are not accredited, some big and some small. It really depends. But I think it's a smart thing. I think it's a good idea. I think it does, at some level, reduce the litigation risk. But again, we've had almost no litigation here, so we've been very successful without it. But I think that the county, I think the corrections department has important reasons to do this, and we support our partner. So we'll do what we need to do.
All right, Manny.
Good morning, Mr. Chairman, members of the board. Actually, it was during the times where we were doing budget cuts. It was actually a cost issue when we were doing the furloughs and we were making cuts to our budget. What it is there's a cost associated to the certification.
So we would have done it before, but
We actually had the certification in place. To maintain it, it would have costed the county a significant amount of money to continue with the certification. And that was part of the decision with command staff at the time. Just like he mentioned, the services didn't change. It was just going after the certification.
Okay.
So it was a decision for budget purposes.
Okay.
Now, I mentioned earlier that we needed to add staffing to get NCCHC. I think what we had before was IMQ, which is slightly different. So moving from IMQ to NCCHC requires slightly different staffing. So that was what I mentioned.
Okay. And I think, one of the, having toured our facility, and I think something that's different is in our jail is that you can tell there's a heart from our corrections team for the people that are in there, wanting them to get better. As a custody care where you're solely focused, what are some of the things that it was touched on before in terms of that, what happens after and to lower recidivism? How do you see you play into that? How do you help with that person when you're saying we treat the whole, that whole person also has a life on the outside, and how do we keep them from coming back in?
You guys want to
So I think it's a great question. Thank you for asking it. What's interesting about when a patient comes to custody, it's much different than if we're going to go buy groceries, we go to the grocery store. If we're going to go buy shoes, we go to a shoe store. If we want health care, we go to a hospital. When we go to a jail, we're not buying any of those things. And when our patients come to jail to see us, it's really important that the care of the patient is in the caring of the patient, whether it's behavioral health, dental, or medical. We talked about the training that's provided to our team members. It starts at the point of intake, the answer to your question, and how we treat and address and diagnose and identify the patients who have comorbidities. Sometimes they have medical and mental health conditions, and we address it right then and there. We identify it, and then we're essentially promoting the patient to have their own health and well-being, provide the services from the point of intake through their stay with us, and give them some ownership to their care. And then Devin and Dr. Katraba, if you want to talk about the connection to the community.
So absolutely, that's a great way to say it, Amanda. With regard to our integrated team and our treatment team meetings, we are watching all of the documentation from the point of intake, but also updating it during each and every patient encounter. And that's not just with mental health, but that's with the physicians, that's with the nurse practitioner, that's with the RNs. And our treatment team meetings really focus on the patient's goals and needs, and we update that with progress, making warm handoffs and planning for their services. We work very closely with the correctional officers to know when they're expected to parole or to be released, so that we have the timing lined up for them, giving the patient all of their information so that they have it, they're ready for them. In the case of the seriously mentally ill, we'll also arrange transportation depending on what their treatment care needs are. For example, it could be NA or AA services, and there are sometimes times where those folks come into the jail, right, and meet with the patients, because that's a warm handoff to make sure that they understand what to expect.
Thank you. Yeah, because I just heard we're at times normed for corrections or for a correctional facility, and it sounded good, but at the same time, you know, again, we're trying to reduce the amount of institutionalization that these individuals are having so they can be productive members of society. And our corrections staff has done some pretty amazing things. I've got to see some of their presentations on, you know, treating them for that. And so I just want to see what that feel is for them, and that, you know, normed for corrections doesn't mean, you know, it's just one more place where they have to have too much rigidity and in terms of their overall care.
Actually, and normed for corrections really takes into account that some of our patients, like was mentioned earlier, have never received health care before. And as one might imagine, if you meet a perfect stranger and you were to say right off the bat, "Are you suicidal?" How many people do you think would just open right up to you? Not very many, right? And so we really take pride in building rapport with the patients. And when I say normed for corrections, it's to take into account the patients who may not be forthright in the beginning for all kinds of different reasons, or they may have been here before and they may have secondary gain, right? And we want to make sure that we're treating the right patient at the right time for the services that they truly need.
Okay, thank you. Supervisor Wheeler?
Yeah. I'm looking at my notes here so I could figure out what I was going to say. So you're saying that 500 people come to our jail a month?
Yeah, we intake about 500 people a month into the jail. Some of them get released very quickly. Some of them
use a microphone.
Yeah, about 500 people a month. So from January through October of this year, we had about 4,895 intakes, something like that. So about 500 a month. And
only about 2 go to the hospital you send a month?
So of that 500, roughly, I think the total that we had, 4, I'm sorry, yeah. So we had about 43 people who at intake got.
At yours?
No, I don't think so.
If we could have some of our correction personnel take Mr. Warnock out of here for
Lock him up. $10, buddy.
So over the same 10 months, we had 43 people who got sent to the emergency room for further evaluation. But
So out of the 11 people, how many's at the jail full-time every day? Either 1, 2, 3?
Well, so we have 19 full-time, or 16, it'll be 19, but almost 17 full-time equivalents at the jail every day. And 11 of those are full-time, and some of them are like 30-hour week, 20-hour week kind of people.
So you handle all the emergencies right there when they having a whatever it might be, ache or whatever, huh? You can handle them right there.
Again, I think it is important to understand that in the jail, so the jail, we have a full-time provider. Debbie Massetti is there full-time, but that's 40 hours a week.
Yeah.
The jail is 365, 724, right? It's constant. So there are many, many times of the day when there is not a provider on site. During those times, which is the majority of the week, nurses have to be very, very good at assessing, triaging, treating people. And so they work with physicians, on call and other things, but they have to be, I think, well above average. And so having a group of people that have been doing this as long as they have is really important.
Right, I think so too. Let's see. You said Madera is way below the state average?
Yes.
That's very
Correct.
interesting. And
I think it's about a third of the state average, if I remember correctly.
wow, that's really
Good.
I've been knocking on wood a couple times when you said low litigation, and
I'm not trying to bring a
knocking
curse.
on wood every time
And California is a very aggressive litigation state.
Yeah.
It's the most aggressive that we serve.
Yeah. And just while he's looking for, how many FTEs just specific to mental health do you have at the facility? Or
Now we have one, but we're adding a second, right? So it'll be two, right?
Right. So we're going to be adding a second to complement the one that is there. And we also have services at the juvenile facility.
And that's in the proposal, okay. Did you have more, Tom?
I'm done, no.
Okay. Supervisor Rogers?
Yeah, I just wanted to make a couple of comments on the deaths in custody and litigation. I think that's as much a credit to Madera County staff as it is to the hospital personnel too, because in fact, maybe more so on it. I would weight that more toward the corrections staff than I would toward the medical care that actually in a facility, because they prevent a lot of things that create those circumstances that lead to death. I think they're in contact with the inmates a lot more than medical staff are. A lot of times when medical staff get involved, it's because that the corrections officers see a situation or see a problem, and those things aren't even always detected at intake. It's from good corrections habits, and we have a great chief and good people that monitor those things inside the jail, so that's really an important component. I just wanted to give kudos to our staff, because that's the first time I've seen that figure, and that's pretty great. And to know that they're stemming the tide of not only deaths while in custody, but of litigation as well, that's important as well. And that goes both ways for the medical care that's been received too, because litigation definitely would be a part of that as well. So.
And I agree. I think that collaboration between custody or secure or corrections and medical is critical. And I think it is one of the unique aspects of doing this kind of medical work, because we can't see any patient that doesn't get brought to us by the corrections team, right? So if you don't have a great relationship and you don't have people that know how to work well together, it's very challenging. So I think, frankly, the team, our team, and the WellPath team and the corrections team are really one team, and I think they work very well together.
And I just have one question for you to comment on, if you want to comment on it. But I'm a math guy, and money talks, and the money end of things. I sit on the RHA, Regional Health Authority for Fresno Kings, Madera, and it's like a lot of it's very Greek to me. I mean, I don't speak Greek, but I've learned a lot about quality care and all those kind of things, and the different classifications for Sarah Boss could tell you the story. We sit on that commission together, but money, I'm on the money end of it, so that's where my responsibility lies in the RHA, and I have that big responsibility here. So when I do the math on this, for the 19 employees that you have that are full-time, we're looking at approximately $70,000 per employee difference in the bids. I mean, any comment on that?
70 or 7?
70. When you take 1.3 million and divide that over
the difference, about $300,000 a year, I think, is the difference.
300,000 a year, but that's over I'm talking about over the entire contract. So you're.
Yeah, so I think
25,000, approximately 20 to 25,000.
So I think we have about, I think 2.6, I don't remember exactly, 2.6 million of salaries and benefits costs, something like that. In my experience, it's not unusual for us to be 10 to 20% higher than others in that cost category. So I think probably of the $300,000.
So that accounts for that.
I think, well, again, I don't know, but I wouldn't surprise me that that's a big chunk of it. So I don't know. I don't know what the others bid, but I do know that.
That kind of jives with what you were saying earlier.
That's my experience. And again, there may be 100,000 or 150,000 that's overhead. I really don't know.
Yeah, that's over the 3 years. So.
Yeah. I mean, to that point, I mean, your slide where 88 cents of every dollar stays here. Right. I just took the 5-year the difference between yours 23,858,673, 89 cents, if you did 89 cents on the dollar, that comes to the 21,334 that Community the last one did. So it's pretty much all on the margins that goes out of the community over those 5 years. The difference is literally that about 11% spread.
Yeah, and I think, look, I'm not denying we're higher, all of that, but I do believe that the services we provide, and I believe that the support, so that all pays for support, right? We have, lots of people that support what we do. So we have people that spend their entire days thinking about nothing more than how can I improve this piece of correctional medicine, right? So we have Dr. Kotraba and people like her who are focused on mental health, behavioral health, suicide prevention. We have an entire team focused on suicide prevention. We have an entire team focused on medication-assisted treatment for opioid addiction, because that's becoming a bigger and bigger issue for us in jail. So, we have people that do that work, and that's all they do. I mean, again, this is a weird little thing we do. Correctional medicine, but we do it really well, and we have people that focus on this. And again, I think some of that is not here. I mean, that exists in San Diego and Nashville and other places. But I think it's really important that we have that support to allow us to continue to get better at what we do. I think ultimately that's a big reason why we have 33 partners in California, because they recognize that this is something that they can hand off to us and we can do better than they can. That's ultimately.
I think this is an important question to ask. So if you continue to stay, there's obviously another bidder within the process that you have to work with as a partner locally, which would be the hospital. How do you see ongoing relationships with there? How could relationships be better? How can the handoff, when it does have to go to inpatient services with them, how can we get better at that?
Feel like it's a problem?
I'll go ahead and start, yeah. So in terms of the relationships, I think we have a couple of opportunities. One being their partnership and collaboration in some of our multidisciplinary team meetings for our patient care. And I think their kind of increased awareness of the limitations that we have in the jail, as well as the things that we are able to do in the jail, would be very helpful. And so having them involved in some of our more challenging cases would likely promote that collaboration.
So one thing I will say that in the 33 counties we have in California, we do quarterly quality assurance meetings that are unusual in that we invite people from the community. So in those meetings we have, they aren't just typically 3 or 4 people. They are, in many cases, a dozen or 2 dozen people in a room, including county mental health. Sometimes even we've had public defenders in there. So we bring in the community to try to do that. And typically, the hospital is represented in those. So I'm not sure if that's been the case here or not, but I think it's something that's gone really far to help. Ventura County is a great example. There's a county hospital in Ventura. That county hospital is very, very closely entwined with what happens in the jail. They attend those meetings, and I think it does help. So I think that is something that could be done.
If there's no other questions, anybody else? Is there anything else you'd like to add? Or
we appreciate your time. Thank you.
All right. Thank you, and we'll take another 5-minute break and come back for NAFCARE. Is everyone back and ready? All right.
There's Rever be.
All right. So now we will move on to NAFCare. And looks like we'll get from both angles. This will be nice.
Yes. Yeah. Thanks. I wanted to start standing. So really appreciate the opportunity to address all of you today. Do you have the PowerPoint up? There we go. Appreciate the opportunity to address all of you today. Really appreciate the care and concern that you're showing going through this process. This is really an unusual process in my experience, and the level of attention that you're giving this, I believe, is merited and appropriate. And so I commend you for this process that you're going through. I'd invite you to ask questions along the way. I've heard you listen attentively to the other presenters and wait till the end, but if you have questions along the way, please ask. We really would like for this to be a dialogue. So I'll start with introductions. I'm Brad McLean. I'm the Chief of Operations for Administration of the company. I'll be taking over as the CEO next month. We're a family company. We're a company that my father started 30 years ago. He was a pharmacist working in a small corner drugstore that my grandfather ran, and he filled prescriptions for a contract for LaGrange, Georgia, and he started to learn about the correctional healthcare field and decided I can do this and I can do it better, and decided to start a company and went to the bank and tried to get a loan, and they laughed at him, and he took out a second mortgage and maxed out the credit cards and built the company we have today. So it's really an incredible success story in terms of the company we built, and I'm honored to be here. In my past careers, I ran nonprofits and I was a public interest lawyer. I joined the family company 3 years ago. It's the best decision I ever made. And to me, it is absolutely a continuation of the public service mission that has driven me in my career. And the people we're able to help and serve. I have with me Jack Donahue. Jack is a 27-year veteran of the Las Vegas Metropolitan Police Department. We met Jack when we were the provider at the Clark County, Nevada jail. He saw what NAFCare can do in taking over the health care there. He retired for about 2 weeks, I think, and then we stole him. He was getting tired of being retired. He's been with us for 6 years. He runs our Las Vegas office.
Thanks for your service.
Thank you, sir. And he's an incredible leader. Also have with me Jesus Ordaz. He hails from Chico, California, born and raised, not far from here. He is a veteran of the Air Force and has been in correctional health care for 11 years. We met Jesus when we took over the Spokane, Washington jail where he was working. We quickly saw him as a talent, made him the health services administrator. He did that for us for 3 years, and now he's a director of operations and a growing star at NAFCare.
And thank you also for your service.
If you have any really hard questions, direct them to Jack and I, because this is Jesus' first presentation, so I asked to go a little easy on him. Again, we are really honored to be here and appreciate the opportunity. At NAFCare, we're mission-driven and patient-focused. We don't have any outside shareholders to report to. My father, Jim McLean, owns 100% of the stock of the company, and so we answer only to our patients and our clients, and that is our commitment. I want to start by making a couple of points that may be important to make sure that when you look at the different proposals that you have before you, that you really are comparing apples to apples. One of the things that I saw when I looked at the pricing for the different proposers is that our pricing increases by 6% and the competitors increased by 3%. Now I'll tell you why we did that. In response to the Q&A, it was issued May 17th, 18D. It said, it is the intent of the county to request contractor to provide cost calculated at 6% CPI for the full 3 years. And then at the end it says, county will expect an annual true-up should the CPI be lower than 6%. So I'm concerned that you may look at our cost numbers and think we're higher. If you look at that year 3 number, we start to creep higher. We looked at the CPI for the past 10 years, and the average is 2.91. I would expect it would be 3%. And so if you look at more of an apples-to-apples comparison of our price based on what the actual price is likely to be, then our average price is $4,443,200. Sorry, I'm reading the wrong numbers. Our average price is $4,444,500. $575, and WellPath's is $4,630,055. So we're a little lower on average, if you look at our price, consistent with the RFP and the way it's written, than WellPath. So I wanted to make sure that I made that point and that you were comparing apples to apples and looking at our proposal. One of the things I really want to emphasize is in a transition, we are really focused on coming in and keeping the staff that you have, especially when you have the kind of incredible talent that you clearly have here. And our focus is to come in, take even better care of your staff than the incumbent is, provide them even better tools, and help them do their job. So it's clear that you have a strong staff, and that is the backbone. And if we were fortunate enough to be selected as your correctional health care partner, we would welcome your staff into our family and be as dedicated to them as we are to our patients and our clients and the rest of our 1,400 employees who work for NAVCare. So I want to give you kind of a quick overview of NAVCare. We do 4 things. We provide comprehensive health care in jails. We manage off-site care for the Federal Bureau of Prisons. We manage that care for about 30 facilities, including 4 in California. We do dialysis jails. And we also sell our tech care software. We're not just a correctional health care company. We're a software innovator in the correctional health care and correctional space. So some of the largest jails in California use our software and purchased it through a competitive process. None of our other competitors in the comprehensive health care space can say that they have a product that they independently market successfully to clients that just want software. So we absolutely have the best technology in the field, hands down. We have 30 years of experience where our focus really is jails. And we liken jails more to an emergency room and prisons more to like a nursing home. When folks are getting arrested and they're being brought into jail, they often have urgent and undiagnosed medical needs, and you just don't have a minute to spare. It's critical that you quickly intervene, diagnose, and treat those illnesses and address those medical needs. We really pride ourselves on being strong partners. We pride ourselves on being flexible, transparent, and build relationships with our clients that are based on mutual trust. So we're going to dwell a lot kind of on this slide. So in terms of the services that we provide or would provide to you if you were to select us, we surround you with a network of services and products that protect you and protect your patients. So I'll start with our proactive care model. Our whole model is focused on quickly intervening and addressing your patient needs. So the NCCHC standards, for example, allow for the mental health evaluation to be done within 14 days, a history and physical examination to be done within 14 days. We'll do all that up front in booking. Now, I understand currently some of that intake screening is being done by corrections officers. That was my understanding based on the RFP language I read. We would take all that off of you. We put registered nurses 24/7 in booking to do a comprehensive medical, mental health screen, and history and physical examination, so we can comprehensively identify and diagnose your patient's needs as quickly as possible. In a jail setting, there are times you don't have 14 days. So our philosophy is really to do that up front. If you look at our proposal and our staffing, we bid in 22.9 employees. So that was 3.25 employees higher than the staffing that you offered in Exhibit B of the RFP. So we've provided a higher level of proposed staffing and more nursing to meet our model that not only meets the NCCHC and Title 15 and CMA IMQ standards, but exceeds those standards. We also have strong experience with accreditation. Our Chief Medical Officer, Dr. Jelfa Alvarez, is on the board of NCCHC, is one of the foremost experts, and we also have had 100% success in getting and attaining accreditation for those clients who wish to have accreditation. If you look at all of our clients across all lines of business, jails, prisons, our dialysis clients, excluding software, we have about 60 facilities that have some form of accreditation. So we're very good at that part of it, and we certainly could obtain accreditation for you. So one of the things that really does make NAVCare different and unique, and we just see ourselves as one of a kind in the field, is the Tech Care service. This software that we developed in-house that is designed around jail standards. So a lot of the products that are out there as far as software services are based on billing. That's what hospital EMRs are focused on. Our Tech Care tool is focused on how you provide health care in the correctional setting. And we are ONC certified as a complete EHR. So we know some of our competitors will brag that they have a certification in one or two of those 24 modules. Because we're an ONC certified complete health record, we can bridge to anyone. We can bridge to a health information exchange, we can bridge to a hospital, and providing that kind of patient care bridge of information today's age, so that we have information readily available and are able to share information on our patients, is critical. One of the things, there are so many things about Tech Care, I could talk all day about it. One of the things that Tech Care does is we have a bridge to a service called SureScripts. And so SureScripts can confirm if you come into the jail and say, I'm on medication, I can't remember what I take a little white pill. If we have your name and your zip code, we can quickly identify what medication you're on through that service. And then we can quickly start that medication. The other piece that comes together to really make NAVCare different is our StatCare service. So StatCare is our stabilization 24-hour assessment team, and it is a group of nurse practitioners, nurses, pharmacists, medical providers who work in our Birmingham office and have 24/7 access to your patient's charts. So basically kind of putting all of that together for you. That patient comes into the jail at 2 a.m. on a Saturday. Your on-site provider isn't going to be on-site until Monday. That the nurse can ask the right questions, use SureScripts, confirm what medications that patient is on, and either through the phone or just through the computer, talk to a nurse practitioner who can start that medication right away. No one else in the field can do that. If that patient comes in and they're in a hypertensive crisis or they need medication, they're not on medication now, there's somebody available 24/7. You don't have to call a doctor, wake them up. We have that ability with California licensed providers to quickly start those medications and quickly intervene. Because again, you may not have until Monday when that on-site doctor comes on to start medications and stabilize that patient.
Is that no one else in the field of jail, like this focus, like your different competitors, but the hospital would obviously have that because they have on-call doctors that are there locally. Is that correct? So is it within the jail field?
I would say within any field based on the system we have. So certainly a local hospital has a network of providers that they can call, but I'm not aware of anyone else in the field, whether it's a government-run, hospital-run, or other company-run program that has a service where the software is...
Doesn't that StatCare, that proprietary software?
Yes, sir. It's that bridge between that Tech Care software package that we built and that StatCare 24/7 service, all those California licensed nurse practitioners who are mental health nurse practitioners who can start those medications right away, quickly go in, see the patient's chart, have their full history, and start something. Now, when your on-site doctor or nurse practitioner comes into the jail on Monday, they may see the patient and say, I want to adjust your dosage, or I think this other medication would be better for you. But again, if you want to keep patients on site, not have to send them to the hospital, manage them well, keep them alive, improve their health, early intervention is critical. And we have just some unique tools that we offer that no one else in the field has that I believe would be a huge benefit to you here in Madera County. We have 100% track record of having our software system up and running day one of go live. We are really good at transitions. We will be here weeks in advance. We will be training. We will have folks in our pharmacy. We have an in-house pharmacy in Birmingham. And we'll have pharmacy techs who are looking at all the medications, loading all that information into our software. There'll be a clinical review by pharmacists to make sure the dosages are correct, that there aren't any contraindications or conflicts between medications. And that will all be there. So on day one, the software is there, and our nurses can go out and do pill pass. The software can go offline. Internet doesn't have to be working. They will have every patient's medical chart on that laptop in the housing unit while they're doing MedPass. So if a patient comes to us and has a sick call, has a request, we don't have to wait to take care of that. We can say, I can pull up your chart right here. I can do a basic assessment. So those are the tools that we can offer that are unique in the field of correctional medicine. Another thing that's a huge focus for us is managing patients through withdrawal. A lot of people call it detox. I like to call it managed withdrawal, and medication-assisted treatment to help our patients with opioid use disorder. We'd love to partner with you in those fields. One of the things that we do that I don't believe any other provider does at every site, I know some companies do it at some, is we use buprenorphine to help our patients through withdrawal. So when a patient comes into your facility, they'll be monitored through the Clinical Opioid Withdrawal Scale, or COWS. Once they start to enter into a moderate withdrawal, we'll administer a dose of buprenorphine and provide that for a 5 to 7 day period. You have patients who go from being throwing up and so sick they can't get out of bed to quickly feeling normal, feeling fine, able to make a court appointment, able to tend to their other needs. We started this protocol 2.5 years ago at one of our facilities in Oregon, Washington County. Worked really well, refined it, rolled it out across all of our facilities. And we would have that protocol in place for you on day one. A lot of the doctors I talked to say when they went to medical school, they learned that patients don't die from opioid withdrawal. They just feel like they're going to die. That was always wrong. We know it's wrong now. Patients can die through that withdrawal process, through dehydration and electrolyte imbalances. So we have to do better, step up, and intervene more quickly in that process. We do that well, and certainly would do it for you. Again, having an in-house pharmacy doesn't just mean we can get the right medications to you efficiently and effectively. That's another level of clinical oversight. So if someone comes into the jail, we check they say they're taking medication, we confirm their prescription through SureScripts, and we start them. Our pharmacy is watching those cues, and they're all scheduled for a chronic care visit to make sure that a doctor sees them and makes sure that when they were on the free world, they were on the right medication. So there are all these quality assurances built in, and we continue to evolve and improve them in terms of making sure no one falls through the cracks. You don't get to make mistakes in correctional health care. Any mistake that you make with this fragile patient population can be a bad healthcare outcome that we don't want. We're very good at utilization management and paying claims. As I said, we handle more off-site claims management for the federal government than any other company in the country. So we're very good at paying the right amount to the right payer promptly, which is what the doctors and the providers want. They want to be paid on time. Community partnerships are really key to us. We only have the patients for a very short time. We have a whole department that works on building networks and making sure that we have relationships with community providers, and that through our discharge planning, we're getting patients connected to care when they leave. I probably shouldn't praise a competitor here, but we really love the Madera Community Hospital. We provide off-site care at the Federal Correctional Institute in Mendota, and we do a lot of work with Madera Community Hospital, and everyone on my team thinks very highly of them. So if you picked us, those were the first phone calls we're going to make, really building that partnership to your community hospital. The mental health crisis is one of the things that the jails face. You're absolutely right. And we're very good at mental health. You do have, according to the RFP, a real high needs population. The data I read indicated you have 17 suicide attempts or suicidal, parasuicidal gesture patients per month. So that's a high mental health needs population. So with that, I'm gonna wrap up, and I'm just gonna ask Jesus to say a few words about his experience working for NAFCARE, and then we'll have Jack say a few words, and we'll try to get to your questions. Thank you very much.
Thank you, Brad. Good morning, everybody. So like Brad said, my name is Jesus Ordaz. I want to take a little moment and just tell you about why I do what I do as a nurse. So I became a nurse because I wanted to help my community. I wanted to care for underserved populations. And so in thinking of this, the best way to do this was to work in corrections. And so I did. I applied. I was hired, and I started working for the Spokane County Jail. This was 11 years ago, roughly. And so I started working with the Spokane County Jail, and then through the process, I did learn that we were very much reactive to patient care. We were having officers down in the booking department, the booking area, doing the medical screenings, the medical intakes, and we were not seeing all our patients that we needed to follow up on. We had individuals that were coming in with high blood pressure, hypertension, diabetes. We were not catching the people that were at high risk for alcohol and or drug withdrawal. And so bad outcomes started happening. People started dying. I'll fast forward a little bit. 4 years ago, NAFCARE came into the Spokane County Jail and they helped us out. And so one of the things that really stands out to me is the proactive care model that is brought on with this company. So we have a booking nurse down, or a nurse down in booking that takes away the receiving screens from the officer. Now we're doing it. And at that point, we're catching everybody right up front. Anybody that's coming into the facility with chronic care illnesses, they're high risk for withdrawal, we're catching them at that point. We start monitoring, we start medications. Stack care feature, we can send alerts to the providers where we are able to start medications. And we start medications, we don't wait for a delivery of 24 hours if we get them from another facility. We have them in-house. So by the next med pass, we are already delivering their medication. And then when it comes to our detox patients, seeing how we had a few deaths in the facility when I was there, before NAFCARE, I have a special place in my heart for them. So the detox patients, anybody that comes in, we start monitoring right away. If they start having symptoms of withdrawal with vomiting, diarrhea, we start medications. We can start IV fluids, and we're caring for these individuals right there so that we have better outcomes. Sometimes we have individuals that come in from the street, they get booked in, and they're already off of drugs. They haven't used drugs, and so they're already starting to withdraw. We're already behind at that point. So the 1-800 number that we have for Stack Care, amazing. We call. They always come in on the weekend, on night shift. Right? They don't come in during the day when we have a provider there. So calling the provider is it's waiting for them to wake up. That's a part that I'm very happy that NAFCARE has provided this Stack Care service, because we call, as soon as we call that phone number, we're getting a provider on the other side that's licensed in our state. And we're able to do aggressive treatment with buprenorphine. We're able to care for the individuals right there on the spot without having to send them out. And so, and from my experiences, people that, once they reach a certain score on the cows, and we start them on buprenorphine, and 12 hours later I see them again, they're telling me, I feel normal. This is what they're telling me. Their vitals, it shows, they are stabilized. They're interacting with people now. They're coming out. They didn't want to get up at first. The first assessment, they don't want to get up. They just want to lay in bed. Now they're coming out. They're interacting with people. They're interacting with our assessments. So just to talk a little bit on this. This is, to me, what we had before, we didn't have NAFCare, to what we have now. It is complete 180. We went from being reactive to all their care needs to being proactive. And I mean, that to me, this is the reason why I continue to do this. It's what I signed up to do. So, thank you.
So my comments are just a little bit different. Actually, on the flip side of the medical side, actually standing in uniform as a jail commander of a 4,100 bed facility and watching this chaos take place on a daily basis. Earlier on, before we had NAFCare as my vendor in the Las Vegas area, we had a lot of issues. Once NAFCare came in, implemented the proactive model of care, it was a drastic change. Booking over 225 inmates a day, coming in with various states of crisis, whether it be opiate detox, alcohol withdrawal, or just any kind of chronic illness. I was able to see that proactive care model in action take place and improve the efficiency of our operation in a jail that size. I don't care if you're in a 400-bed facility or a 4,100-bed facility. All jails have similar issues, if not exact issues, just the model scale, if you will. So my testament on the proactive care model is you know what you have up front, coming in the door, so 4 hours later, you're not being reactive, allowing correctional officers have to transport to the hospital. Is that whether it be a ploy for security reasons? It was someone trying to escape, or more generally, it's to get the general care that they need. So that's my comment on the flip side is the uniform side. This model works. It's proven itself in a large facility. It works in small facilities. So with that, we'll move on to the next slide. So.
Can we go back to the slides there? Okay, yeah.
Okay. So I'll continue with this. NAFCare has opened back in 2013, 2014, our West Coast regional office in Las Vegas. We have a wide variety of disciplines that work in the office, from traveling RNs that handle training, recruitment, our West Coast medical providers, whether they be nurse practitioners or medical doctors. As you see on the other column there, these are our comprehensive care clients in California, Kings County, Mendocino County, and the city of Santa Ana. Tech care alone, as Brad mentioned earlier, is sold in a different line of business for those that run county-operated facilities, such as the sites you see above. So those facilities, those jails actually use our tech care software in their everyday operation. And of course, the Federal Bureau of Prisons collaboration that we have, as Brad mentioned earlier. I think that's for that slide, so we'll move forward. I think that is it. So we'd like to open it up for questions, and we'll do our best to...
Came in just under the 30 minutes. I was going to give you some extra time, too, because I asked a question during it. I hate doing that.
We want to be efficient with your time and happy to answer any questions.
Yeah, I always like to give people the time that they have when I start asking questions, and it takes away from there. So, but I see Supervisor Rogers has...
Yeah, it's getting close to lunch, so forgive me if I'm vague. My brain's starting to lose its protein.
Protein withdrawal.
Yeah, protein withdrawal. You got any cure for that?
Not that I'm aware of.
Lots of food, right? Yeah.
That's right.
You mentioned early on in your presentation that the figures shown in the presentation were skewed by CPI requests from the. Can you explain that again? Because I want to zero in on that. I want to hear it.
Yeah, absolutely. So there was yeah, I can speak to that because when the controller who takes the first stab at putting the numbers together sent me our proposal, I said, 6%? We're not charging 6%. Where did you get that? And he said, well, it's right here in the Q&A. They said they want for you to price it at 6%, recognizing that the actual consumer price index for this area for medical services is less.
Lower, and then a true-up at the end of the year.
Yes, sir. So I would expect, based on the past history of a 2.91 average CPI, that based on your RFP, our actual cost of living adjustments would be closer to 3%, not 6%. I didn't even want to put 6% in there. I just did it because there were pretty clear instructions, the way I read it, that you wanted to see the numbers that way.
So let me synopsize that by saying that it's subjective then to the figures based on what we have here is figs, apples, and oranges, because you have one that's below the normal CPI, you have one that's about at CPI, and then one that was above CPI,
right?
Because your interpretation was that was the request, and very clear in the instructions that was the request.
Yes, sir. So from my standpoint, the fairest way based on the way you structured the RFP, it's your role, not mine, but
Is to add 6% to everybody's figures, and
that would be one way. Another way would be to just look at the year one price and kind of recognize that under the RFP, everyone's COLA is going to be a cost of living adjustment is going to be a function of what the consumer price index does. It's the same for everyone.
right,
The way you structure
because there's a
it.
true up either way. So that
Yes.
could be more for actually more money to them, average for you guys, but a lot less for you.
Yes, sir, that's correct. So the structure is the CPI up to a maximum of 6%. So if one year it was 7% for some reason extraordinarily high, that cost of living would still only be 6%.
So Darren, is in the RFP, did it say that 6% or?
Yeah, I want to hear more about that.
Sure,
Because
it's,
it's really, to me, that really skews the picture here financially, and that's a very important number for me.
Sure, it's page 4 of the May 17 Q&A response, answer 18B. So I have it in front of me. It just says, it is the intent of the county to request contractor to provide program costs calculated at 6% CPI for full 3-year period. So that's what we did.
Were you shocked to see a conservative budgeting county in California?
Come again?
So were you shocked to see a conservative budget approach in California?
Yeah, the information in the RFP itself calls for 12-month period of data from the CPI or all urban consumers U.S. city average for medical care services, or 6%, whichever is less.
Oh, okay. Okay.
So that was the original RFP, and then there was a Q&A that clarified that. Question and answer. Correct? So I may have misread it, but that command
I
seemed
think
clear
that-
to me.
I think it's important that we get this clarified, because I want to know that we're on the same track here, so I want to hear from staff on that regard. That's a little bit of a monkey wrench to me.
While they're looking that up,
While they're looking at First question, Brad, what happened to Alabama Saturday?
Oh, I was happy because we're an Auburn family, so it was a good day. I did feel bad for the Alabama kicker with that field goal, just hitting the post. It kind of hurt your heart, but
yeah. Just had to throw that in. So, have you ever bid on Madera County before?
I can't remember for sure. I don't think we
have
did.
not, sir.
Okay.
If you do happen to get this like this, would you have permanent employees that would be living here in Madera County also?
Oh yes, absolutely. So we bid in again 22.9 total full-time equivalent employees as our staffing matrix, and those would all be local employees. The only issue would be if you have a health services administrator who takes vacation, and we send in Jesus, or we send in someone else to kind of babysit the site, but,
I
right.
understand that one. And,
We'll hire locally, yes, sir.
Yeah, so you had 3 in cities and counties in California. Is that about the average size of your staffing for those 3? I'm not talking about the state and the feds, just the cities and the counties, jails.
That is a good question. You know, of course, staffing varies by the size.
of the
So
jail, yeah.
off the cuff, I would say so your facility is 486 adult, 44 juvenile. I would say that is about average. I would say I struggled with when we after we submitted the staffing matrix and looking at your mental health needs, we put 1 mental health professional, and I heard our colleagues with WellPass say they're adding 2. I think that's really a wise move. One kind of unknown for us when we bid on this was there'll be a partnership with the county behavioral services and county mental health folks. So we would expect some level of support. But you do have a high needs mental health population, and it strikes me as wise to go from that strikes me as a wise move to go from 1 to 2 licensed clinical social workers. Yeah. I'm not allowed to change my bid, or else your attorney will promptly set me straight. But if I could go back in time, that's probably what I would have done, and I think that's a wise move for WellPath.
Okay.
Darren?
Yes.
Speaking of changing or altering the bid, what's the?
So we checked the addendum. So here's the question. I believe this is the right question. You correct me if this is the wrong question. Okay. Since the CPI cannot be determined for renewal years 4 and 5 at this time, is it the county's intent that program costs for renewal years 4 and 5 are to be calculated at 6% increases over years 3 and 4 respectively? Our answer is a little long, but I'll try and just read it so that we can all be clear. It is the intent of county to request contractor provide program costs calculated at 6% CPI for the full 3-year period from the date of contract execution. Further, it is the county's intent that contractor calculate any other annual price increases or decreases based on the CPI for all urban consumers. U.S. city average for medical care services for 2 additional 12-month periods preceding the renewal date of the contract as stated in the RFP. This additional program cost for the 2 additional 12-month periods would cover renewal years 4 and 5 respectively. County will expect an annual true-up should the CPI be lower than the 6%. So I think that the 6% was worst-case scenario.
But if I'm reading that, just the lead sentence is saying we expect it to be 6%, and then take out anything, and then the next one was, or take out anything that you think based on those years, right?
Yeah, I would think that would have been an indication that to be safe, assume 6%.
Yeah, so, yeah, I think that, I mean, my immediate interpretation was exactly what you brought forth. And so, when we look at these figures, I mean.
Right, and I think, and I'm sorry for interrupting.
No, go ahead.
I think this might be an opportunity to talk about cost in the context of the RFP, not specific to the CPI, but just generally. And so in guiding you and making your decisions, a couple of things. The first of which is that in the RFP itself, it states that while cost is important, it's not the most important. But probably more importantly is that the RFP goes on to define the award of a contract as an invitation to negotiate a contract. So, I mean, I would look, this is my own personal take on this, but these cost proposals I would look at as an indication of price. Based on your award, then successful contractor would sit down and negotiate a contract with the county.
Very good point. Thank you, Darren. That's a very excellent point.
I couldn't have said it better, so thank you.
Yeah.
And they all seen it the same. I mean, they all had the same RFP,
Yeah.
so they all could read it, just depended how they interpreted
Interpreted it, right.
So,
And the cost was a small portion of the overall score.
Well, I wouldn't say it was a small portion. It's just that it was set forth as not the most important factor. Certainly an important factor, but
Right.
not necessarily the most important factor.
That was a good point. Thank you, Darren.
All right. Any other, Tom or Max, David? I thank you for, by the end, you've heard a lot of the questions. I see you answered a few of mine that were in terms of like the higher level of mental health. One of the things, so you have a proposed under your model of 22.3 FTEs?
Ours is 22.9 FTEs total. The staffing matrix is in the proposal. I can point you to it if you wanted to look at it, and I also have it on a slide.
Why did you choose that? What did you see that made it that much more?
We, compared to the staffing matrix that you gave in Exhibit B of the RFP, which I assumed was the well path, we added nursing time and some higher level nursing time, some RN time, so that we can do that upfront history and physical examination.
In the gate.
Yes, sir, in the gate, in the booking area. That has to be done by an RN or higher. It can't be done by an LPN. I believe we added a little bit of provider time, but I would agree with, I think that the additional staffing we proposed is needed, and I would hope you give the contract to us and let us hire that staff, but even if you stay with your current provider, my humble opinion is it would be wise to make that incremental investment in additional staffing and care, and that really can get you to that level of accreditation, or in our case, above and beyond the accreditation standards.
And then you also answered in your presentation the cost of onboarding and transition. So I thank you for that. Let me see if I had, in terms of, again, the overall feeling of what we're trying to do with our jail population, which is not have them come back to us. What do you feel is your role in that in terms of helping to lower the recidivism for Madera County?
Absolutely. So, the main things that drive recidivism are substance use disorders and mental health, as you well know. So, providing a higher level of mental health care, providing a higher level of care to patients with substance use disorders, really, and then connecting them to care upon discharge with robust discharge planning. Those are really the keys to success. Medication-assisted treatment in the jail setting is something that hardly anyone did 4 years ago, and now there's a rush to do it. It's the right thing to do. So basically, that MAP program is providing some medication to help control those cravings that opioid addicts have. So basically, if you're an opioid addict, your brain has been hijacked. You don't care about your family. You don't care about anything except getting high. So even with the behavioral therapies and those kinds of interventions, the success rate of people getting clean without medication-assisted treatment is relatively low. So you can provide buprenorphine or methadone, or naltrexone is the oral form, Vivitrol is the injectable form. Those are the three medications. Methadone is the hardest to get in a jail, but generally for us that requires a community partnership. But that investment in a MAP program is something that we would love to give you, and that we hope you do, whether you pick us or not. I think it's a key part of the answer to that question. Without belaboring the point too much, there's Rhode Island. Their experience has really been heralded as an example. They started MAP. They have a combined jail-prison system, and they started providing in-jail, in-custody MAP programming to everyone who was incarcerated in the state. And they found decreases in overdoses when people left. So what you see, and we've all heard the stories. Joey was just discharged yesterday, and he overdosed. Those patients, they're used to a high level of opioid they were abusing. They've been in jail. They've lost their tolerance. They want to get high. They go out and use what they used to use, and they overdose. So those were some of the things that we would do. We're always trying to innovate as well and finding ways we can go beyond to support those kind of services. We've developed a software system that is called Courtify, where we partner with drug courts and mental health courts and try to consolidate information to help quickly connect patients to those diversion programs. So if you're a low-risk offender, you're really not in jail because you're a danger to society, you're in jail because you're mentally ill or you have a substance use disorder, and we can quickly divert you out of jail into care. That's good for society. That's good for the taxpayer. So, we'd like to see less people in the jails, and we want to be part of the solution. So we'll continue to innovate and find ways to try to achieve those objectives. It's the greatest challenge we all face. How do we stop the revolving door? I don't think anyone has the answer, but we're getting better every day.
And I would agree with that. I think the standard in the industry, it used to be the mental health issue and the detox opiate issue was kind of just a secondary thing. And, custody paid the price. They watched the detox and just the decomposition of the patient go on throughout his incarceration. Now you have to have that in place up front. And on the end, of course, is that discharge planning. You have to have that collaboration with the community to have that warm handoff. In my career, we didn't have that warm handoff. It was out the back door and back in the front door a few hours later. So I think that is the standard of the industry now, and we have to make sure that we uphold that.
Yeah, I think in listening to you, it kind of made me realize what this was about today, and hearing all of it and taking the time and the care to try to understand this is, this is when you were talking about your career in corrections, is that if it's not triaged correctly, if it's not, that puts our employees, our corrections staff at risk with people that could be dangerous. It puts the other population that's in there at risk if they're not properly diagnosed. And so it's important for us for public safety and for the safety of our employees to make sure that we do this right. We fully understand the decision that we're making and how it relates to keeping our employees safe and those other ones in the facility. So thank you for tying that in.
Yes, sir.
Supervisor Wheeler?
Yeah, thank you. Karen, could you come up here?
Is there any other questions?
Oh, I have no more for them.
Okay. Any other questions for NAFCare? All right. Thank you so much, and I think we may end up calling different ones back and forth.
If I could, I had a point I wanted to make in closing. We also have that Arista MD service where we can consult with specialists throughout the field. It's a very valuable service, and I was glad to hear WellPath uses it. We use it. Sometimes folks kind of confuse that with stat care, and I really just can't emphasize enough how unique stat care is. It's one thing to be able to consult with the doctor and get feedback in a day or a few days, but being able 24/7 to talk to a provider anytime and get feedback within minutes is what we offer that really no one else can offer. Really appreciate your attention to this matter. I think all the presentations have been great and the questions have been great. So thank you so much.
Thank you.
Thank you.
Quality organization.
Supervisor Wheeler?
We're going to open up so we can ask other questions now.
Yeah. We'll have a staff presentation and then we'll.
Oh, okay.
We'll do.
That'd be good. Yeah. I'd like to hear from them too.
It's been a long morning, so I'll move quickly. Just to talk a quick second about the evaluation process that's been done to date. As outlined in the RFP, all proposals were evaluated by a county selection committee responsible for making a recommendation to your board for for the awarding of a contract to the contractor whose proposal best serves the overall interests of the county. The committee reviewed written proposals, attended bidder presentations, and met to deliberate and rate proposals based on weighted criteria set forth in the RFP. That criteria has been up a couple of times so far this morning, but I'll just run through it again quickly. The criteria was sufficiency of personnel, administration, and healthcare services, which was weighted at 30%. Staffing plan, which was weighted at 10%. A cost proposal weighted at 30%. Relevant correctional facility experience of key staff, 15%. And qualifications and experience of key staff at 15%, and then completeness of the proposal. Following review and deliberation, the committee recommended award of the contract to WellPath. With that, I'll turn it over to the committee to discuss their recommendation.
We're just missing one of our members of the committee. I believe she's going to be going first.
Why don't we take a 5-minute break like we've done between everything else to let people, that was fair to everybody else, and then it was unfair to our own staff to be able to get it all together. So, whether.
That's amazing. Yeah. That's so
All right. Thank you, everybody, for your patience with that. Chris, do we have jail food services coming in to cater this lunch here today? No? Okay. All right. So we'll start now. We've got the presentation up. Chief? Oh, Jessica, you'll start.
Good afternoon, Mr. Chairman, members of the board. Jessica Leon, analyst with the administrative office. So as previously discussed, the committee met and deliberated in several locations to discuss the qualifications of each contractor. The following is a summary of the committee's findings and major distinctions between the three proposals, starting off with accreditation. Accreditation is an important factor as it is crucial that all applicable state and federal laws, regulations, codes, guidelines, certifications, credentialing, and licensing requirements are met. NAVCARE and WellPath hold a 100% success rate in acquiring and maintaining National Commission on Correctional Healthcare Standards accreditation, mentioned as NCCHC going forward. NAVCARE has an accreditation department that is dedicated to assisting sites in achieving and maintaining accreditation. Under NAVCARE, each site is monitored 6 months prior to the NCCHC visit. A clear accreditation plan is in place under NAVCARE. NAVCARE has never failed to obtain nor lost accreditation status at any of their client facilities. Similarly, WellPath has internal quality improvement programs that guarantee WellPath clients meet all applicable national and state standards. Mock NCCHC surveys are conducted at each facility prior to the actual on-site audit. WellPath carries the distinction of counting 20 Triple Crown sites among their clients. Triple Crown refers to WellPath attaining and maintaining 3 distinct accreditations in a single facility for 20 facilities. WellPath will even pay a self-imposed penalty of $10,000 if the facilities fail to achieve NCCHC and/or California Medical Association accreditation as a result of deficiencies in the medical program they provide. WellPath has never failed to obtain nor lost accreditation status at any of their client facilities. Madera Community Hospital, going forward MCH, has no proven track record of attaining NCCHC. MCH is accredited by the Hospital Facilities Accreditation Program, FHAP, but that is unrelated to the accreditation request listed in the RFP. Tremendous uncertainty remains on how MCH will attain NCCHC accreditation for Madera County facilities. It is unclear if MCH has dedicated and experienced staff that will assist in the preparation of NCCH accreditation, or what procedures are in place to assist facilities in obtaining accreditation. Experience played a huge role in the overall recommendation of the committee. I will briefly discuss experience in a correctional setting, and my colleagues will further discuss this topic. NAVCARE holds 29 years of experience in a correctional facility and provides services to 11 California facilities. WellPath holds 35 years of experience in a correctional facility and provides services to 33 California counties. That is over half of California, 14 of those counties being right in the Central Valley. MCH, although it works with several Central Valley correctional facilities, it has no experience in a correctional facility. So I will now be going over a few of the healthcare services as proposed by each contractor, strictly as submitted in their RFP. I will not be reading line by line, but instead just highlighting a few areas that the committee categorized as important, beginning with mental health. Mental health is such a big component that the committee spent quite a bit of time discussing and reviewing this segment of the submitted proposals. NAVCARE and WellPath have an extensive mental health division in which policies, procedures, and guidelines are established. A key finding in NAVCARE's submitted proposal is to provide specialized mental health and therapy to the juvenile population, including life skills programming to prepare juveniles for success at discharge. Similarly, WellPath had a few key findings, one of them being the fully established suicide prevention program. Both NAVCARE and WellPath have a detailed crisis management program and offer telepsychiatry. Telepsychiatry is a complement to traditional on-site healthcare and is key as it is utilized to reduce off-site transportations. MCH stated that it will develop policies and procedures defining mental health screening, and evaluation of all inmates, as well as developing a suicide prevention program. The details on what these procedures will look like is unknown to the committee. Moving to dental care. Both NAVCare and WellPath offer on-site dental services for its established dental program, which clearly defines emergent and urgent dental conditions. MCH does not have a system or plan for prioritizing response to dental needs, nor does it have a periodic performance measurement to ensure timely access to care. MCH has not determined if a dentist will be contracted or hired. Withdrawal management services such as detoxification are significantly important as many individuals arrive in the correctional setting under the influence of drugs or alcohol. NAVCare and WellPath have a detailed withdrawal management program in which receiving screening, observation and monitoring, and treatment steps are described. WellPath even provides correctional staff with quick facts for intoxication and withdrawal, designed as a quick reference to assist correctional staff in identifying patients in need of medical intervention. The committee is uncertain on what the withdrawal program looks like under MCH. MCH states that a written detoxification protocol will be developed and implemented. So moving on to cost. Contractors were asked to describe a detailed plan for the implementation and operation of a cost containment program, which was to include contractor plans for healthcare cost, areas in which cost savings will be achieved, and evidence of the success of such a program at other contract sites. NAVCare submitted detailed cost containment strategies, which include, but not limited to, the use of the electronic operating system TechCare, which will increase efficiency and quality of the healthcare program, an in-house pharmacy program that will effectively manage pharmaceuticals, and reducing emergency inmate transportations by providing a comprehensive utilization management and medical scheduling services. One of NAVCare's evidence of success is from Hamilton County Corrections System and reads, NAVCare has reduced overall off-site trips by 50%, going from 1,157 to 575 trips. Similarly, WellPath submitted detailed cost containment strategies, which include, but not limited to, utilization review through the care management system for off-site services, third-party billing claims management, and enrollment of eligible patients in Medi-Cal through the Affordable Care Act. One of 8 success stories for WellPath is from the Davidson County Sheriff's Office in Tennessee and reads, with our care management system in place, the Davidson County Sheriff's Office saw their off-site trips cut in half within the first 6 months of our contract implementation, resulting not only in reduced hospital and community provider costs, but also in reduced transportation costs and officer overtime. On the other hand, MCH states that it can assure the county that costs for jail health services will be effectively contained, but it does not describe how. No clear strategies were submitted, and there is no proven track record or evidence of successful cost containment. Moving further into cost. Contractors were asked to identify the total program cost in their submitted proposal. The cost proposal was to include the actual program cost for the primary term of the contract, which would cover a full 3-year period from the date of execution. Upon mutual agreement, the contract may be renewed for 2 additional 12-month terms. The cost proposal was also to include the actual program cost for these 2 additional 12-month extensions. While cost was an important factor, it was not necessarily the most important. As described in the RFP, the contract shall be awarded to the contractor that has a demonstrated ability to fulfill the requirements based on past performance and specific correctional healthcare experience. Ensuring the county continues to not only meet but exceed state standards is of the utmost importance. The level of service stated in each of the proposals was carefully analyzed and utilized to evaluate the proposed cost. The indirect or soft costs of each proposal were taken into consideration during the scoring process strictly based on what was submitted. For example, the cost of transportation of inmates and youth from correctional facilities to outside healthcare services is something the committee reviewed closely, as this is something that not only would drastically increase costs for the Department of Corrections and the Probation Department, but would also increase the county's liability. The current cost of medical services is $4,128,833. This is a decrease in the first year of $28,833 when compared to MCH, an increase of $185,032 in the first year when compared to NAFCare, and an increase of $365,057 in the first year when compared to WellPath. Please note the issuance of acceptance to award does not guarantee the proposed cost. And now Chief Perez will speak further.
Good morning, Mr. Chairman, members of the board. Director Manuel Perez, Madera County Department of Corrections. I've been appointed as a director since 2011. My responsibility is to operate and manage the department that conforms to federal and state statute. In doing so, I'm responsible for the sole purpose of care, their welfare, and safety of the inmate population incarcerated in the Madera County Department of Corrections. We have more stakeholders today than previous years that are providing excellent services in both medical and mental health services. In 2015, the Department of Corrections, working closely with our partners, Behavioral Health, Probation Department, Madera Superior Court, and other stakeholders, was awarded the Mentally Ill Offender Crime Reduction Grant in the amount of $869,547 for a 3-year period. Even with the sunset of this grant in 2018, we've continued to provide the same level of care in regards to mental health services to the inmates incarcerated. A dedicated mental health court and veteran court was established. Coordination with the mental health clinician assigned to the jail as a liaison to assist from the criminal proceedings to mental health services and programs. This is an example of one established and very successful program that we have at the jail. This service is very critical in helping the sensitive population of incarcerated inmates, to include Armstrong class inmates from CDCR. Armstrong class inmates have their own ADA guidelines from California Department of Corrections Rehabilitation. This is a direct outcome of the lawsuit that ACLU and CDCR prisoners' treatment and care, because Madera County Department of Corrections houses state prisoners where also are to follow such mandates. Having staff and medical provider with institutional knowledge is key to our success. The department has had numerous inspections from the Bureau of State Community Corrections, Madera County Health Department, and grand jury inspections. We are proud to be transparent in our services and have always strived to not just meet the mandated medical and mental health care, but to exceed the level of care and the safety to the inmates. As the administrator, I oversee and manage all services contracts, to include medical and behavioral health services. For delivery for such services and require all parties to maintain the highest level of service. Fresno County just recently changed medical providers to increase the level for medical services and behavioral health services. San Luis Obispo County found themselves in the same situation after a death in custody. A large settlement was ordered against the county based on the lack of medical and behavioral health services from their local medical provider. They have also awarded the medical and behavioral health services contract to a vendor with institutional expertise. I want to emphasize the importance when we talk about institutional expertise, because that seems to be an issue. Why is that important? It's important because several of the vendors even talked about the liability and the high level of care that these individuals are taking. I agree, medical services is not medical services. We are constantly being looked at every single day by day, by outside experts and legal to see if Madera County is doing anything wrong. And if you give an opportunity to show that we are not hitting all gears or all cylinders at any given time, that puts us at risk. I'll give an example. Our visiting system went down, technology, and how critical having a visit from a family member was when we started getting phone calls, not just from the public, but from the media, of how important just a simple visit services were. I was getting calls from Sacramento. It was not an option of when it was going to happen. It was going to happen. They wanted to see results immediately. It did take us a little while because we had to get a vendor that was willing to step up to the plate immediately and provide services. It's sort of hard when you go to a vendor with your hands empty, but you have a need. But there are vendors that stepped up and got us out of that situation. As soon as we got that situation, our services increased. We have better services. I'm proud to say that we now have services where family members can visit from home. So we've increased. We never stay status quo. Anytime we're going to do some changes and there is a disruption in services, we always have to get better. And that's exactly what we did with the visiting. And now it's just a small example. We talked a little bit about death in custody. It's not something that we're proud that we're on the low end of the list. Everybody should strive to be on the low end of the list. But it's not a one-person team here. It's your partnership. It's behavioral health. It's our medical providers. It's our staff. Somebody mentioned that today. Kudos to our staff. Absolutely. But we have rules that we have to follow. They have to do their security checks. But having a vendor supporting us when we have to make that emergency call, I've seen our medical, to give an example, I've seen our medical providers take care of somebody that I would think would have to go to the hospital, would take care of them right there on site. Because sometimes these individuals will hurt themselves to a point where it becomes an escape risk, where we just can't send a correctional officer, we have to send an armed guard. And this body understands that I'm limited with my armed officers because I contract with the sheriff's department. So I'm very limited. If it's after hours, we have to make phone calls. We have to make them very quickly. So keeping people in the facility is very important to us. But I am proud. I am proud to say Madera County came in almost last in death in custody. I'd hope that we get better and we get last. You know, there's one smaller county that beat us. That's okay.
I'd call it second place, not last. Second place.
We're doing good. We're doing good, but again, I truly believe it's that partnership. I just want to finish with, this seems to be the direction of most counties when they find themselves in litigation for lack of services and lack of policy and procedures. Madera County is not currently under any imminent litigation or pending threat of litigation due to these services. One of the three vendors has institutional knowledge of Madera County Department of Corrections. With a proven track record in providing all the services required by law and being in compliance with all other governing bodies. All policy and procedures are in place and are constantly being updated as laws and regulations change in California. In conclusion, the committee make an articulate decision based on all the facts presented, and I support that decision and recommendation that was presented September 3rd, 2019. Thank you.
Thank you.
Good afternoon, Mr. Chairman, members of the board. My name is Chris Childers. I'm a Deputy Chief Probation Officer with the Probation Department. I have prepared a brief overview of the juvenile facility, some of my key impressions of the proposals, and my final conclusion that I made. The juvenile facility relies on the medical services to provide constitutionally and state-mandated health care to youthful offenders. Keeping youthful offenders healthy in a correctional setting is complex and very unique. Having a dialogue between medical staff, correctional staff, and the parents is paramount in this carrying out this care and maintaining continuity between the services being provided. Youth in custody have a particular health care need, which go beyond just pediatric care. Oftentimes, these youth are victims of abuse, neglect, trauma, and experience mental health problems. When our youth come into custody, they often need mental health attention and treatment. Any delay in a youth receiving mental health care may lead to the youth contemplating self-harm. As such, there is a compelling need to ensure that practices and policies are in place that can adequately address these issues. A youth health care is a basic platform from which a youth will eventually be returned to their parents, and we want that return to be a healthy one. In consideration of the contract proposals, a number of factors that I took in consideration favored the incumbent. These factors include experience in pediatric care, specifically in a correctional facility, policies that meet the state juvenile institution regulations, policies that are in line with our own facility operations, mental health services that cover the routine, the acute, and the crisis psychiatric needs of the youth, and an established staffing schedule that meets and exceeds the needs of all the youth in custody. Some additional statistical factors include 0 deaths, knock on wood, of youth in custody, no litigation against the department, 1 youth transported to the emergency room in 2019, and 4 unfounded grievances of medical care in 2019. The state of California rules and regulations, Title 15, set a very high standards of health care for juvenile institutions. The California Board of State Community Corrections conduct a 3-day inspection of our facility, and much of that inspection is review of policies in our medical care. The California Board of State Community Corrections inspections also has variable oversight, and they also offer support to ensure that the counties are in compliance with these standards. Over the past 10 years, the juvenile facility in Madera County has passed each and every one of these biennial inspections. And lastly, and in conclusion, my strong consideration was given to correctional experience, existing policies that currently meet Madera County and state standards, the proven ability to deliver services to youth who are in a correctional environment. Given these factors, in consideration for minimizing the county's liability, the incumbent contractor had the advantage, in my opinion. Thank you.
Good morning, Chairman and board members. I'm Dennis Cook. I'm the Director of Behavioral Health Services here in Madera County. I plan to only take 4 minutes here, so we know where we're standing. It's a long day. But I think it goes to show the importance of what we're doing here. The important work that is going on, the effect of the decisions made today are going to be felt for quite some time. I completely appreciate the thoroughness of the purchasing agent, the review committee here in front of you, and now your board. In fact, this has been a very professional and fair process from the review committee. Usually the review committee, in fact, is not even identified. We're usually kept anonymous. Today, your review committee not only is identified in front of you, but we're even in open public forum. We are sharing our recommendations to you. Highly unusual, shows the importance of the work we're doing. I listened to the questions that you all had, and those are some of the questions we had. I listened to the discussion you had. Those were the discussions we had. We looked for answers in our questions in the RFP, the proposals given by each of the agencies, and then we discussed them with each other. We first came up with our independent ideas, and then we discussed them with each other. The RFP gave us directions on what to do, and I'm just going to read briefly what it told us. All proposals will be evaluated by a county selection committee. The committee may be comprised of county staff from appropriate county departments. It will be the committee's responsibility to make the final recommendation. The committee will recommend award to the contractor who, in the committee's opinion, has submitted the proposal that best serves the overall interests of the county. That is the most complete and responsive to the requirements specified in the RFP, that adheres to the requirements of the RFP, that submits an acceptable cost proposal, that has demonstrated the ability to fulfill the requirements of the RFP, and that has demonstrated the most competence, past performance, and experience. While cost will be an important factor, it will not necessarily be the most important. The approval of the Board of Supervisors is required to approve an award of contract. The committee, as
in the RFP was directed to allocate 70% of the points to experience. The review committee looked for specific areas to assess experience, as stated in the RFP, that has most demonstrated the ability to fulfill the requirements of the RFP, and that has demonstrated the most competence, past performance, and experience. Components of experience, we looked at 4 of them. We looked at a lot of them, but 4 of them came out. Staff and organizational experience in providing healthcare services. Experience working in a correctional institution. Experience implementing required laws, codes, and regulation governing correctional medical services. And lastly, experience providing mental health services in a correctional institution. As you know, we've talked a lot about providing mental health services in a correctional institution. The review committee reviewed policies, procedures, accreditation experience, staffing qualification, and other documents submitted by each agency. The RFP had 3 main areas to look at, and that was the qualification and experience of staff, relevant correctional experience, and costs. We realize that qualified and experienced staff is a cornerstone to these services, as some of the questions earlier had discussed. The committee reviewed each proposal looking for relevant information to assess the qualification and experience of the potential vendor. Then the review committee looked at relevant correctional experience, and it was noted from each of those in the proposals they submitted. And then we looked at cost. Cost was a very important and very complex. Cost for medical services are interrelated with the cost at Department of Correction and Behavioral Health Services. Savings in one area may lead to additional costs in other areas, as we talked about. An example could be where the vendor was able to save costs, but unintentionally created additional costs for the Department of Correction or Behavioral Health Services. Also, cost savings could result in missteps and end up with litigation. I can assure you that the review committee took their job very serious. Serious because there are many violent people locked up in the facilities. There are many sick people locked up in the facilities, and there are many people with serious mental illness locked up in these facilities. When something goes wrong, ultimately it's the county that is responsible. Our jail medical provider will have far-reaching effects and impacts on the community of Madera. Recommending the most qualified vendor to ensure the county's needs are met was paramount. The committee was comprised of staff from the 4 departments that are sitting in front of you today. We reviewed over 1,000 pages of documents. We reviewed corresponding federal and state codes that directed medical services. The committee met as a group to discuss each member's independent findings. We heard presentations from each prospective vendor, and then we met again to discuss the presentation and to formalize our recommendations to your board. Lastly, the committee submitted their recommendation to your board for consideration and approval on 9/3/2018. We, the committee members, stand by our recommendation that was presented on that day. Myself and other committee members are now available for any questions.
Tom?
Shouldn't have waited. I found more questions. This is a long process, and I think we're doing it the right way. I just want to thank everyone, the committee, you guys, and very professional, the staff, very professional, the bidders, very professional, all of you. It's just amazing when you sit down and start analyzing this kind of stuff, what it comes up. So one question I really want to ask is if Karen, you would come up here for a second. I just wanted to say that I liked the way you gave your presentation about why you thought you didn't get a better rating and stuff. After seeing all 3 of them, I kind of see it myself what happened. But you didn't have a full-time employee list of how many you might have. Do you have that off your head?
On our staffing proposal?
Yeah.
It was, I think, 19.8 or 6.
19?
Yeah.
Okay.
19.6.
0.6, okay. And you talked about what you're about and what you can do, but not quite ready. I don't think you're quite ready for this obligation. I wish you gave us more of of what you were going to do and stuff like that on that. Have you ever done any accreditation with like the NCCHC?
Well, we are accredited in almost every aspect of healthcare that we do currently. We've not applied for accreditation through this organization because we are not providing jail medical services. That accreditation would not apply to what we do at our
Except for
hospital.
jails?
It applies to jails specifically. And so, of course, we don't have that accreditation, but our experience is very strong for the last 48 years of being an accredited hospital, and we're accredited in our lab, we're accredited in our outpatient rural health clinics, we're accredited in our radiology services that we perform. So we're very well versed on obtaining accreditation. And like I said in our presentation, the first thing that we'll work toward, and we've already been in contact with the Commission on Accreditations for Jail Health.
Yeah.
We bought the 5 books. I've read over those books probably at least 10 times. We based our proposal exactly on that accreditation standard is. We will assure you that we will have all the staff in place to meet the requirements of the Commission. But like everybody says, and all the other vendors are right, it's more than just meeting those accreditation standards. It's really understanding the complexity of taking care of these difficult patients that show up in the jail, just like they show up in our emergency department. We're well versed on that as well. We know it's a challenge. We've said that over and over, and we talked about that in our proposal. So yes, we are well aware. And we are definitely the underdog here. We don't currently do jail medical services, but we do a lot of healthcare services in many different areas. And one of the things I want to say is that, again, we all of our whole proposal and every policy and procedure that we've written are based on making sure that it's approved by the accreditation standards for jail medical services.
That might be.
Yeah. So again, when we start our services, everything that we do will be based on that.
Right.
So the other side of it, the other 2 vendors, of course, already have that built in, and because they're doing it today.
Right, yeah.
You wouldn't be doing
There's
it,
a
or
lot
you
of
wouldn't
them,
have those
right.
if you aren't doing it, right?
Right.
So.
Do you know of any other hospitals that does this kind of work at jails and stuff?
No, I just wanted to say, I said Tuolumne County, I meant to say Tehama County is where we visited, and they were the ones that were the closest that we have found. Now, I'm sure there's some out there, but we did research and we didn't know of any.
Just not very many.
Not very many.
Right.
So I think, we would be doing something that's, very cutting edge to collaborate and provide these services locally with the hospital in combination with our county and with our correctional facility.
Okay. Then on page 12, if you looked at that over yourself and seeing what our committee had to look at, and the mental health, the dental services, x-rays, detoxification, you can see why I see now why anyway, they come up with these numbers,
And if you look at, and I understand, listening to where the selection committee is coming from, but what I want to say is we've done extensive research on all of those programs to make sure that if Madera Community Hospital is the chosen provider, that we have from day one those services in place. That's why we've visited other county jails to make sure that we're ready. And, we've already built and developed the policies and procedures on that. And I think inside of our proposal, we do have some of those examples of those programs and what that would look like as far as the screening, the medication assisted treatment program. So I think we put some of that stuff in the proposal. I'm not sure, but we do have it. We've looked at it. We're ready to work towards,
Yeah.
So anyways.
Okay, that's all I have questions for that right now.
Thank you. I actually had one for WellPath that came up during the NAFCare in terms of the extra staffing for the RNs to intake. How is, or maybe this could be also Chief Rose, how is it done now? Is it done with is it our staff that right now is doing the initial
what we
intake?
currently have is, we have questions that the arresting agency, when they do, we refer to as a booking sheet. On the bottom of the booking sheet are key questions. And those key questions, if any of those questions are answered yes, it immediately triggers a triage. So the medical provider, wherever they're at in the facility, if they're doing med pass or they're in their office, we notify them to do a triage. So we look at how they answer yes or no based on those questions. And to give an example, is the charge related to a use of force where a baton or a dog was used during the arrest? We look to see if there was any type of vehicle accident that would cause a person to come into the facility injured. We do an observation where you either answer yes or no. And if there's like 6 questions, and if anything is answered yes, we do immediately triage. Once if let's say the arresting agency says no, or let's say we do an observation where the person is arrested at home, and that person is adamant that they have to have their medication with them, and they come to the jail with their bag of medication, which is not uncommon. It happens on a regular basis. What happens is we actually look at that, and then we'll have medical do a triage. We do have an area next to the intake area where it can be utilized for full-time staff. But again, I think we have to look at the years that we've been doing business, and we have to pretty much watch how we do our cost, because for medical services, as a director, if I immediately mandate that I need an extra nurse full-time, that increases our cost for the following year. Just to give an example, we have a thing where if our population is over $500 or our population is under 500 inmates, we pay a per diem. Sometimes if we maintain a high level of population in the jail, it triggers a tier 2 where we need to go back to the contract and renegotiate because we're not able to keep our population down. With our current vendor, we've been able to work through those issues where they understand that sometimes we are above 500 and we meet that threshold, but they've been, I don't want to use the word kind, but in business, they've worked with us not to increase our cost. So we are constantly looking at what the cost increase is and do we have it budgeted within what we budgeted for the year.
Yeah, I understand that budget part, but if someone's coming in and before they get admitted, are there times that they get taken to the hospital before they get taken to?
Well, if you look at the percent that we take to the hospital with our arrest, it's less than 1%.
That's once they get into our
Once they
facility?
come, yes.
But before that?
No, that's before they come into our facility,
Okay.
yes. But are you asking how many do we take to the hospital once they come into the facility?
Yeah.
That number is even lower. We don't have a common occurrence where we take somebody to the hospital because we missed something.
And in terms of, just trying to get into the psyche of someone who's arrested, and the person that's asking them the questions is the person that just arrested them, they probably don't have a whole lot of trust or willingness to say things in terms of what their mental or actual health status is. You said we never stay status quo, right? Which I always want to be pushing that, look at what it does to the budget, but if it's the right thing to do, it's the right thing to do. In terms of having that process to get people in and actually get a better understanding of what their overall health, mental health, their overall health before we bring them in, because it's only going to cost more if we don't know those, if we don't get them properly
To answer the question, if somebody comes in on a mental health issue, there's not much that the emergency room is going to be able to do for them.
Oh, it's a 5150 hold.
Right, but that decision has to be made prior to them coming to jail, if we're referring just to mental health. Because even with the 5150, we are not going to deny them. It's still going to be considered an arrest. For example, if you have a homeless person living under a bridge that has mental health issues and they did something and committed a crime, that is not going to trigger for us to send them to the hospital, because we have to consider what exactly is the hospital emergency room going to do for that individual. Probably we're going to provide more services in the jail than what they're going to provide at the hospital, because that's immediate care. we've sent them in the past where they're, within an hour or two, they're back, because that's exactly what they will refer to as, well,
Your
it's an
safe room is
emergency
the same
room,
as
there's
their
no.
safe room.
Exactly, so,
No middles.
so a lot of times we bring them in under those conditions. The only time that they do go to emergency room is if the person falls under the criteria that there is a health condition that we may not be able to provide that level of service while they're incarcerated. Let's say, for example, the person is complaining of having a heart attack. Something to that effect, where we'll do a triage, they'll check the vitals, and if the vitals support the high elevation, the high blood pressure, the signs and symptoms of their body, the cold sweats, then most likely the decision would be made to send the person to the hospital as a precaution to get them proper care and treatment.
Is that before booking or?
That is before booking, yes. Yes. And penal code supports those decisions. I have the authority to deny somebody coming to jail under a medical condition in order for them to get cleared at the hospital.
Okay. Where's that penal code?
It's under the penal code 4000. I can get that to you, but I won't try to memorize it.
Supervisor Wheeler.
Yeah. Manuel, do they have an office, you have an office there at the jail for these services?
Yes.
And there's usually somebody in there 24/7?
Well, I have two offices, if that's what we're referring to. There's, under the new construction, where we have the isolation cells, if there's a need where a person is under a higher level of care under observation, we do make an office available in the infirmary, and then they have their main medical area.
Yeah.
And the infirmary is closest to intake.
Okay. I'm ready to make a motion if you guys are ready for one.
Supervisor Rogers.
Yeah, Chief, I want to thank the committee for a thorough job. Really helped me make my decision. And also I want to commend Darren, because as Darren reminded us, there's a consequence for only thinking about the dollars in this kind of situation. And that is true of almost any business. Experience is a very, very important component when you're considering things that are complex. And it involves how things are done and where they're done and the extent to which they're done. I could use construction examples of that myself, where I've gone in as an experienced contractor and found a better way to do something than another guy who decided in the long run, I'm actually cheaper because in the long run, he's gonna tear that down, where I'm gonna just cut part of it out and use the old structure. So and what I'm trying to say is that in every line of business, experience is a great teacher. And when you don't have that experience, it's very difficult to say what you're entering into. It's very difficult to adjudicate the whole picture, or even determine how much money or how many people are going to be needed to operate in that process. And ultimately, in the end, that can cost you more. And you mentioned a large liability a sum that was handed out. Would you care to share that sum with us? Not from us, but
No, not from us. It was actually from San Luis Obispo. It was a scenario where a person was left in a restraint chair for a period amount of time. And there's regulations that pertain to how long a person can stay restrained in a chair. And that has to do with leg restraints and wrist, that you have to give mobility, circulation. What would happen is this person had mental health issues also. They thought that this person was pretending. And because they thought that the person was pretending, they didn't take the situation seriously when the person went limp. And what I mean by limp is they knew he wasn't sleeping, but every time they tried to wake him up, they thought he was playing. And there was a large litigation against them. And actually, you can see it on YouTube. There's the one where the correctional officers are laughing when they found this individual and he was deceased. Again, I think that's part of the leadership there on sharing how important these services are and not taking anything for granted, if they're playing or not playing. But
Well, yeah,
there
that's
was a large
that's the whole
litigation.
thing. It goes to the whole point, and that is that we're dealing with people
Yeah.
that are.
And I believe that it was a $4 million award against
Yeah, that's
the-
a lot of money.
the county.
That makes differences in these dollar amounts very small. We're dealing with scrutiny, as you pointed out. I think scrutiny is a big, big issue here because we are looked at by lawyers daily. We are looked at by institutional watchdogs daily. It's one of the big things.
Reporters.
It just goes on. It just happens. Reporters are waiting in the wings to snipe us. I mean, that is part of the game. But we're also dealing with a client who is, and I call them clients, so use the word loosely, clients who are manipulative, they're savvy, they understand the law, they understand the liability, they know what we're liable for, and they're waiting for that opportunity to take advantage of that situation. And so I think that's why situations like what you described develop, and we're skeptical, and you have to have someone who understands all of this and the limits of the law and what have you. It's a very complex issue. Frankly, the stress would kill me the first week. I think I'd be out, I'd be done. And I've had friends who have been involved in it for years. One of my best friends, Jerry King, told me stories. I mean, he shares stories with me all the time. But and just as a thought, you know, you wouldn't have a labor lawyer prosecute in a murder trial. It's a specialty. It's a specialized area. It's something that you have to understand to do. And that's not an insult to anybody. This process is open for this reason, to allow everybody to put forth their best foot. As I mentioned earlier, my obligation is to the taxpayer to get the best for them in the long run, and we know the liability is just waiting out there in the wings if we make the wrong step. So it's a very important process.
Yeah,
Thank you to everybody for contributing. I appreciate it.
I want to echo those comments that I just want to thank the whole process. This has been lengthy, very educational for, I think, all of us to understand more what's going on a regular basis. This was a hard job. I know why we leave it to a committee so that, because once everybody got up, I mean, there was good things in absolutely every single one of the presentations. And so very, very hard decision to do. I still want to look at some different intake system. I think is important to be able to have that continuum of care all the way from the beginning through the end. I want, this is such a huge part of public safety, keeping criminals away from the community and then hopefully rehabilitating. I know that's a big focus that we have, so when they come back, they can be productive members of society, which makes us all safer. And when we have that captive audience, pun intended, that we utilize that time as a way to try and make people safer on the back end. I see just a lot of work that MCH would have to do to get to where it needs to be. But the care for the community, that next step part is very big to me, and I'm having a hard time reconciling
If
that.
I can just mention one thing on that. We're looking at a succession planning because we're looking at the grant that we just received for the mental health treatment facility. And with the staffing, we were gearing in that direction to staff the person up front, because we are looking at that treatment, that mental health treatment facility in our facility, which is going to be the 24 bed facility, to include some additional training, because we've already been speaking to the current provider about how do we get there. And they've already had experience with other counties working in that direction in the mental health treatment facility. So to address that issue, we've already been talking about the upfront, them coming in, and then the special training, not just the medical, but for the correctional officers, that there's funding for them to have special training also to deal with this high-risk population.
I don't know what Tom's motion's going to be, but whatever it is, I want to see an increased coordination with our local hospital, and obviously it's very easy if they're the contractor, that coordination is built in, but I want to see increased levels there in terms of who's going where, and I just appreciate everybody in the process. We'll see where it goes. Max, you had a...
I sit here and I listen to all this, I call it testimony, and I see my friends over here, and I want so much to support it because I support the hospital. It's our hospital, and I feel so, I feel like I want to support you, but we have a group of providers that have been with the county for 9 years, and our directors here, department directors, have supported, have made a decision, and they support this provider that has been with us for years, and they've done a good job. So I just have to stay the course. I'm sorry, but I have to stay the course. And I'm pretty sure that everybody meant the best for Madera County, but and we have to make a decision here, so I have made mine. Thank you.
Ready? Is there any public comment regarding this item? Seeing none, I'll call close to the public comment portion, bring it back to the board for action.
Thank you. Thank you again, everybody. I just wanted to thank everyone, and this is not easy, like Max just said, to make these decisions. We got friends sitting out here that I think that we should always look locally, which I've always been that way, but I kind of think that the company's been doing this locally anyway. I got every one of them work here and live here in Madera County, and but my decision is based on past experiences and the safety that I know I have to do to our citizens in Madera County. I don't want to jeopardize that. That's our main job, is public safety, and I just want to make the motion to give the contract to WellPath, and in it also maybe work with our local hospital to start bringing them up to speed on what we do and not do, and then in the 3 to 5 years, whenever this contract runs out, if we don't renew it those last 2 years, they can bid again on this.
Want to do it as a negotiate with?
No, just to work with them.
Yeah, negotiate with WellPath.
Hospital.
Yeah, that's what the item actually says, is to
negotiate.
the notice of intent to award. So that will
Intent to award the contract with
notice of intent
WellPath.
to award,
Yeah.
right. Okay. And I'll second the motion, and I wanted to echo what Max said. It makes it really hard to. You got community members out here that you love and appreciate, and everything that was done is really great. I appreciate the attempt to step forward in that.
Right.
I just there's a little gap there, and it's just really I shouldn't say a little gap. There's a big gap there, and it maybe in time that gap could be stepped over. But right now, I don't think it's that time. And so, anyway, enough said.
Madam Clerk?
Call for the vote. Supervisor Wheeler?
Yes.
Supervisor Rogers?
Yes.
Supervisor Rodriguez?
Yes.
Supervisor Frazier?
There was a point where I thought I would say no just kind of ceremoniously. I think that would be disingenuous and somewhat cowardly on my part to leave these other three out here with the community. I do think the same as you, that there is, you can get there. I'm amazed at how far Madera Community Hospital has come in this short amount of time to understand something so complex as jail services. But at this time, my answer would also be in the affirmative, yes.
Vote passes. 4, 1 recused.
What was that?
All right. Thank you all. That includes 3A. Any pending legislation?
We have one. It's not, it's just, I wanted, a letter of support's got to be in by the 4th for the PILT PILT dollars.
Oh, Phil, yeah.
Yeah.
Absolutely.
And
Thumbs
it's-
up.
And so we just,
Phil
I don't know
support.
if Bob had that ready or not, he's back there, but he's got the letter that we got to send off hopefully today.
Okay. Yeah,
Okay.
thumbs up, Max?
Thumbs up, Max?
On the Pilt grant?
Yeah.
No.
Thank you.
All right. Any supervisor or staff reports?
Be attending CSAC this week.
I as well. None? Supervisor Wheeler? Nope. All right, with that, I'll adjourn this meeting.
Thank you, everyone.